Okay, hello everyone. I hope you can hear me. Yes? Okay. Can we close the door, ladies? Yes, please, but you can come in if you want. Right, sorry for the little delay in the start, a little technical hiccup, but the brilliant guys, our technical support and live streaming team, which are absolutely amazing, sorted it out. So thank you. And welcome everyone to our second day of the Wellbeing and Heritage Conference. We had a brilliant time yesterday, and I'm sure we'll have another great day today. For anyone who wasn't here yesterday, this is the wonderful Delpre Abbey. We're here thanks to Richard and his team and all the wonderful volunteers who provided this brilliant space for us for free for the conference. So thank you again, and for the support of our colleagues from the Council of British Archaeology and the Southampton Institute for Arts and Humanities, who together with Historic England made this possible. But more than anything else, it's possible thanks to you all and your brilliant work that we're here to showcase and talk about. So in terms of logistics, like a little bit of technical reminders, is that we have these sessions of presentations, 15 minutes each, 3 presentations, 15 minutes, and then we have a Q&A. Hopefully, if we don't overrun, when we overrun, we eat from the Q&A time. As we're starting a little bit later, we'll try to preserve that time for you. The next session, which starts here afterwards, actually, we have a little bit more time for that because, unfortunately, one of the speakers is not coming, so we'll have a little bit more time for that one. So don't worry if we overrun with this, is my point. And if you need the toilet, just outside of here, down the stairs, and then on the right, and your teas and coffees are on the left in the salon. Okay, so enough of that. Let's start with our Heritage and Social Prescribing Part 2 session today. I will have an opportunity to share with you 3 more really brilliant examples of how we can implement social prescribing through heritage. Really brilliant and innovative work that I'm sure you all will be quite keen to hear about. So without further ado, I will start with our first presentations, which is on heritage and volunteering in the whole systems approach to social prescribing, heritage connectors and heritage buddies. These are actually 2 pilot projects which Historic England commissioned last year, Heritage Connectors and Heritage Buddies. They aimed to test how 2 established models of a supportive and helping community roles, such as those of the Connectors and Buddies, could be applied for heritage. I will let our delivery partners, Jenny Hartnell from Froome Medical Practice and Amanda Chambers from the Nottingham Community and Voluntary Service, to tell you themselves about the work under each of these pilots. And we will also hear from Meg Clark from Wave Hill at the end, who led on the evaluation for both projects, and she will share with you findings and recommendations as a result of that work. In one sentence, Heritage Connectors was based on the extremely successful community connectors model that Froome Medical Practice has created quite a few years ago now, based on light touch training of everyday community members in signposting people to social prescribing services in Froome. We wanted to learn from that successful practice how we can adapt that model for heritage, what the steps of creating heritage buddies will be, heritage connectors will be. And we also wanted to understand how this could be potentially scaled up across the country. Heritage Buddies, we commissioned Nottingham Community and Voluntary Service to deliver based on their work and experience of delivering the Nature Buddies program and Toolkit for Natural England as part of their Green Social Prescribing program. The Buddies go a step further than the Connectors and befriend people in need so that they can find and explore social prescribing activities around them until they grow confident that they can access these and benefit from them independently. I will let Amanda tell you more about what we found around how this model can be adapted for heritage later. But just before we move to my lovely speakers over Teams, to explain a little bit why we decided to invest in those two tiny pilots. In NASP, which is National Academy of Social Prescribing's understanding of what social prescribing is and how the social prescribing system works, there are three areas of implementation of social prescribing, so to speak. One where people can independently find and access social activities and support services, that kind of a green independent area there. Then we have the middle one in blue there, where people may need some help and support from friends, family, neighbors, or other helpers and connectors through the community. And then the third one in pink over there, where the health-based link workers fit in, who can offer specialist and in-depth support to those with most complex needs. In this scheme, connectors and bodies fit in that second blue circle, as what they do is to help people find and access services and activities confidently. Now, in NASP and their whole community approach to social prescribing, the social prescribing infrastructure works when we have the following 6 elements. We have community hubs where people can find activities and support services, information and access to information about these. We also have social prescribing link workers who are embedded with the healthcare settings in the community, with the training support networks to reach and support people. We have obviously the connection to services, and this is exactly where connectors and bodies fit. There's these supporting roles to help people access all this. We have a thriving community, which is mainly here, meaning the voluntary and community service sector, who is the hub, the actual provider of all these activities. I mentioned the social prescribing link workers, they just popped on the screen now. Of course, sustainable investment, that's a big one to allow this, of course, to continue, and for the organizations who provide those services to be able to provide this for the beneficiaries and the people going forward. And of course, we need robust data and evaluation to be able to prove to the health sector that these interventions and activities work, and that it's worthwhile investing in this going forward. So after this little introduction, I will play now a pre-recording of a short presentation about the Heritage Connectors pilot given by Jenny Hartnell, who is the development lead for Froome's social prescribing service, Health Connections, and she was also the project manager to the Heritage Connectors project. So fingers crossed this will work.
Hello, my name's Jenny Hartnell, and I'm going to give you a brief 5-minute presentation on the Heritage Connector pilot, which we did in Froome last year, which was a collaboration between Historic England and Health Connections, which is the GP practice, social prescribing and health coaching team, based on the work that we've done over the last 10 years on community connectors, where we've trained over 2,000 community connectors. There are lots of people who know about information around heritage, for example, the Froome History Group, Froome Guided Walks, Froome Tunnels, Weavers and Spinners Group, which is fantastic if people know about it. But there are lots of people who just don't know about it. And if they don't know about those opportunities, they basically don't exist for them. And that's where Heritage Connectors come in. Here's our Heritage Connector, and what do? So Heritage Connectors simply give postcards which have got information of where people can find out information, resources, opportunities to get involved in heritage. So here we have the one side of the postcard, and on the back of the postcard it says the benefits of engaging with heritage. So they give out that postcard, and that postcard then gives them access and knowledge and information about all those things that other person knew about. It's as simple as that. Simple. What does a connector actually do? Well, they signpost friends, family, colleagues, neighbours and strangers to those heritage access points in the community. They only do it if and when they get the opportunity and if they feel like it. There's no pressure whatsoever. So you might have a heritage connector that never signposts anyone at all, and that's fine because they've learned about that information themselves. And you might get a heritage connector who's busy connecting people to those heritage access points all the time. Anyone and everyone can be a heritage connector. We've trained community members and the whole social prescribing team here in Froome, and that was 70 people trained in the pilot. It's not about being a formal volunteer, for example, a befriender or a buddy. It's just a simple signpost that anyone and everyone can do. And the training involves what does heritage mean to you, heritage and wellbeing, linking to those heritage information access points, benefits of being a heritage connector, benefits to the person being connected. 70 community connectors trained in Frome, and we figured out through our other connector project that on average people might speak to 20 people a year. So that's 1,400 people that would potentially find out information about heritage access points that might not otherwise have known about them. So that was a great ripple effect. It's simple training up those people as heritage connectors, but what was involved in actually setting it up in the beginning? Well, first of all, we had to find those things that we call heritage information access points, because we can't possibly tell everyone about everything that's available. We just need to signpost them to places where they can then find out about information that's available. So we brought stakeholders and people in the community together, and it was decided that the Discover Frome, so the town council website, would be the main place of access for that information. And also the telephone of Discover Frome would be places for people who prefer to find out information by the telephone. But what we didn't have was a physical place people could go to. So a heritage cafe was set up as part of the project. So this was kind of bringing people together in the community to collectively decide what those information access points would be. And that's the bit that might take quite a long time, because you do need to bring those people together to agree on those access points. Directory on the Frome Town Council website. So they really built on that during the project, and that was great collaboration between the project here and the Town Council to build up that information on their website. And it also included the heritage and wellbeing benefits on that page too. So as part of the Heritage Connector pilot, we also decided to put some information of heritage opportunities in the pilot area of Frome on our website directory, which is used by all the GP practices in Mendip, which has a practice population of 118,000 and 11 GP practices, and it's used by practice staff and community members alike. So we have the usual things that are on a social prescribing directory, for example, advocacy, mentoring, befriending, bereavement, carers, cancer, diabetes, drugs and alcohol, end of life, exercise, falls, healthy weight, hearing, and we added in this heritage wellbeing category, which hadn't been there previously. So if we click on that, we have the benefits of heritage and wellbeing, which was really interesting having that there at the top of the category, because in the other categories we haven't got that. So that's really informed us to maybe put that on the other categories in the directory. And if you scroll down, we've just got those groups, services, opportunities in Frome to get involved in heritage. And interestingly, if we look at the other areas of Mendip to see what's available there with regards to heritage, just need to take off that Frome. Oh, you click on heritage wellbeing. There's nothing there. And the reason there's nothing there for those areas here, so the Glastonbury, Shepton Mallet, Street and Wells, is because the social prescribing team haven't yet put those opportunities on the website. So it's a real prompt for us as a service that covers lots of different areas to not just think about that in the pilot area, but to think about that and add those things into other areas that we cover, but also to train the team up as heritage connectors so they can, the rest of the team that's out of Frome, so they can be aware of all the benefits for connecting to heritage for themselves in their community and for the people they support. Right. Initially, we sort of brought those community groups together to decide on the heritage information access points. The website was already there in existence and the phone line was, but we just need to build up the information on the website. We built new access points because we needed to have that many ways to many, that people receive information in different ways. So we had the website, phone line, we needed that physical place. So that Heritage Cafe was set up as part of the project. The trainer trained 70 heritage connectors, of including the social prescribing team, and the training content with an impact. So I think the training content changed people's perceptions of what heritage was and linked people through to the understanding of the benefits between heritage and wellbeing. especially within our social prescribing team. So they might not necessarily have thought of heritage as something of signposting people to in the past, but it has built that in. And there's unexpected consequences that heritage is embedded now in the social prescribing work. And also it influences how we explain other areas of social prescribing. And that was kind of when we added in that benefits of heritage. So we're thinking of adding that into other categories on our website. So it's not just about training up those 70 heritage connectors. It's about bringing the community together and those ripple effects. Thank you very much. And just to mention that the Connector Toolkit is going to launch at a NAS webinar on May the 1st with Heritage Connectors as a case study. Thank you very much.
Thank you, Jenny. And as Jenny said, we're going to have a webinar on Heritage on Community Connectors, where the Heritage Connectors are one example. And we'll launch the toolkit as well with the case study of Heritage Connectors on the 1st of May. And if you go on NASP's website, soon you'll be able to book yourself for that webinar. Jenny will also be available at the end for Q&A live. So if you have a question about that project. So I'm really pleased now to go and have Amanda Chambers talking, who is our Health and Wellbeing Manager from Nottingham Community Voluntary Service. She was also the project manager for Heritage Buddies in Nottingham, and she will have an opportunity now to tell you a little bit more about the work on this pilot. I'll just come out of the slides just for a second so I can welcome Amanda on Teams, just to check that we can hear her. Hi, Amanda.
Hi, Dizzy. Hi, everybody.
Wonderful. Okay, so I'll minimize you again, Amanda, and I will share your slides. Like I said, I will. Just a second. Oh, okay. Sorry. Click the wrong thing. Here we go. Okay, Amanda, off you go. Thank you.
Thank you, Desi, and good morning to everyone. And thanks, Desi, for this opportunity to talk about the work we did in Nottingham. As Desi has introduced me, I'm Amanda Chambers. I'm the Health and Wellbeing Programme Manager for Nottingham CBS. And I led the Green Social Prescribing Green Space programme across both the city and the county. And we did a piece of work around Nature Buddies. And it was really about taking the learning from that and looking at how do we move that into a different sector, what needs to change, what's different, what's similar. So I'm going to talk very briefly about our approach, who we worked with, the pathways we developed with our partners, and some key learning points and how you can find out more and read more and learn more in detail about the work that we did. So if I can have the next slide, please, Desi. Thank you. So this is our partnership in Nottingham. We had approximately 9 months to deliver this programme, and a lot of the time at the beginning of that was spent engaging in the heritage sector and with our health partners to understand how Heritage Buddies could work for them, and also to explain to them what a heritage buddy is and how they could work with us and be one of our partners. So heritage organisations, we work with a couple of key organisations in the city and just outside the city. And with those heritage organisations, we worked with their volunteer lead and either their existing volunteers, or in the case of the National Justice Museum, with volunteers that they were recruiting. So for Newstead Abbey and Nottingham Castle, they had existing volunteers who were interested in effectively putting a buddying hat on and supporting people to visit their site. For the National Justice Museum, they were interested in building the concept of buddying into their new volunteering programme. And similar for York Archaeology Project, they were interested in offering opportunities for people to come along, volunteer, and to support them through buddying to take part. We also engage with befriending and community organisations, and one of the reasons for this was one of the key aims of the Heritage Buddies programme was to look at improving the diversity of both volunteers and visitors to the heritage assets. And so we worked with a number of befriending and community organisations that you can see there that typically would not consider visiting a heritage asset as something that they might choose to do or had done previously, or perceive that there were a number of barriers in the way for them doing this. So perhaps it was not something that they felt was for them. And we wanted to work with these befriending and community organisations to encourage their befrienders to act as heritage buddies, to support the clients and the members that they work with to access heritage assets, heritage activities, and open up those new opportunities for them, but equally take new visitors to those heritage assets. We worked with health, so looking at the links between social prescribing link workers, so people who work with patients who have a number of physical, emotional, social needs that can't be dealt with by medication, but by referring them into community-based activities can have a considerable impact on their health and well-being. So looking at how social prescribing link workers could, through heritage buddies, support their patients to access heritage assets and activities. Now, when we were putting this partnership together, we engaged with a whole range of heritage organisations in the city, and we've listed some of those under destinations. Those organisations did not at the time have the capacity to actually get involved in the full Heritage Buddies programme, but what they were willing to be was destinations for Heritage Buddies to take the people they were working with, the participants, to their activities. And they saw this as a really positive way and a new way of reaching new audiences. And I've just listed there our steering group as well. So you can see that we brought together representatives from each of those different groups of partners as our steering group, which met on a 2-weekly basis. Have the next slide, please, Jessie. So this really looks at the models that we developed. And I think the key thing is about this, buddying is really about supporting effective referrals. For an individual, getting a social prescription, getting a referral is only part of the journey and is only the start of the journey. And there can be many barriers to them taking part in an activity. And in this case, in visiting a heritage activity, particularly if it's something they've not done before, if they feel that they don't want to go on their own, if it's not something that is in their culture or their practice. So those barriers can mean that that referral is not effective and doesn't take place. So a buddy is very much an enabler, a supporter to ensuring that that social prescription, that referral, is much more likely to be effective. So we co-produced a range of different pathways with our partners, where you can see on this model the little Heritage Buddies image, the little icon there, is really coming in and supporting those individuals, whether they are coming through a befriending or community organisation, or whether they're coming through a GP or through a link worker, or actually also whether they are referring themselves. There's still a role for Heritage Buddies and self-referrals. So that Heritage Buddy is really key in making that referral, that social prescription actually happen, be effective. If you just imagine yourself taking part in something that's new or going somewhere that you've not been before, often you would try and encourage a family member or a friend to go with you. For an individual, for a patient, for an individual that has high levels of anxiety, is socially isolated, potentially has mobility problems, or is just not aware of the opportunities that are out there, they need that hand-holding to help them take part, to build their confidence. So buddying is a really positive enabler to supporting social prescribing and referral pathways and opening up those heritage assets and those heritage activities to new audiences who may not access them or enjoy them or get the benefits from them for their health and well-being without that buddying role. Could I have the next slide, please, Desi? And these are just a few of the lessons that we learnt when we were developing a Heritage Buddies scheme in Nottingham. There is a full report which has been made public with all of our learning in it, but I just wanted to pick out a few key things. The concept of Heritage Buddies is relatively straightforward. When you try and put it into practice, it does become more complex. But we found the way to overcome that was very much a co-production approach, really working with the different organisations, getting a clear understanding of what a buddy role means for them. And so each organisation develops their approach to buddying so that it works for them and so they can really embrace it. Through the buddying, we encourage community outreach, activity and networking, particularly bridging the gap between health and those heritage providers and encouraging them to meet. So an example of that would be inviting a heritage organisation, a volunteer lead from an organisation or a buddy to go to a coffee morning organised by a social prescribing link worker. It was all about building relationships, building connections, outreach, and rather than just saying we're here, come to us, is actually going out and doing that outreach work. Being really clear and communicating how heritage activities can contribute to health and well-being. Talking about the benefits for your social connectedness, for your mental health, for your physical health, and that overall community well-being. And the benefit of doing this is it really helps to bring different partners on board. It really helps them to see the benefits of them being involved in a Heritage Buddies scheme, and not to assume that people realise what this is, but to clearly define and communicate it. It's really important to fully involve the volunteer leads and the volunteers from the heritage organisations in the design and the development of the scheme, because this helps build sustainability. So we made sure, as we were training the volunteers to be Heritage Buddies, that the volunteer leads were involved in that training, that they helped us design it, so that going forwards they can deliver it themselves to new volunteers joining the organisation. So they take ownership of that buddy scheme and they're driving and developing that buddy scheme within their heritage organisation. And finally, that a single model approach really doesn't work for all organisations. We had to be very flexible and respond to what we were hearing and what we were learning through this project. And DESI allowed us to do that, to be flexible, to take an action research approach, to start with a theory around a single model approach, and then really to explore that and develop that as we talk to the different organisations. And my final slide, please, DESI. And just to finish off with this, is that I mentioned before there is a final report which is we've made public around our learning, which goes into some of the things I've talked about in much more detail. But most importantly, there's a Heritage Buddies toolkit, which provides a step-by-step example, step-by-step process to developing a Heritage Buddies scheme. It's got lots of our learning in there. It gives guidance on how to do it. And hopefully that would be a really useful toolkit for anyone thinking about developing a Heritage Buddies scheme. So that's all I've got to say, Desi. I'm going to hand back to you, and hopefully that's given you a little snapshot of what we did in Nottingham, and I can answer any questions later when we get to a Q&A.
Thank you very much, Amanda. That was brilliant. Thanks. And like Amanda said, we have the Heritage Buddies Toolkit on Historic England's website and on NASP's website as well. And if you go to NASP's website as well and look at their webinars, there is a recorded webinar on nature and heritage buddies, which we did together with Natural England at the end of February. So you can watch that as well and find a little bit more about both types of buddies and all the work that Amanda was involved in as well. And we're also going out on our website the Heritage Connectors case study and the Community Connector Toolkit later in May, after the other webinar that I mentioned. Amanda, Jenny, thank you very much. I will actually leave the Teams meeting as it is now, because I have to use my computer for the other presentations in a moment. We haven't finished with ours, just 1 second. But thank you very much, and we'll rejoin with you for the Q&A. Okay, so thank you. I'll just leave that because the little screen pops up when other people are presenting. However, bear with us a little bit more, because it's time to share. Oh God, I'll start again from the beginning, sorry. I would like to share now with you some of the findings from the evaluation report, very kindly done by Webview, and Meg Clark, my colleague, will be here just to, I guess that's from the beginning. Some of these findings, just a second. Technology is not our friend today, but we'll persevere. Here we go. You can see that. Over to you.
Thanks. Thank you very much. Oh, goodness. Hello, my name is Megan Clark. I'm a researcher at Wayfill, and we were fortunate enough to do the evaluation for both the Buddies and the Connectors schemes together in parallel. So obviously we've learned already some of the findings from each of the schemes specifically, but for us it was to look at the big picture and how it was done in practice sort of overall, how it was led through Historic England as we were commissioned by Historic England in the round. For us, the sort of take-home message, really, because I appreciate we haven't got a huge amount of time, the take-home message is that both the schemes met their core objectives, and that was to test how the heritage sector could contribute to social prescribing. I realise that's the reason we're here today, but both schemes did that, which was fantastic. There was lots of specific learning about that, how that could be designed in practice in the future, how that could be resourced, and that piece that we hear so much about of evidencing kind of what works. There is plenty of that. There's that in spades for both models. As you've heard, the models are very different, but obviously threads running through them. So for us, we've taken learning across the two and the separate learnings as well there. You'll see on this rather busy slide our methodology. I won't read it all out for you, but we took a mixed methods approach to our research. Interviews, site visits. I was fortunate enough to go down to the William Booth Museum in Nottingham, which was a great day, but lots of involved across the whole the year itself. For the successes then, so on the process evaluation side of things, both schemes took an iterative approach. As Amanda said just there, lessons learned as they went, because really it was putting into practice these concepts. Putting into practice these lessons learned and generating that into the toolkits, which will be those legacy pieces for the sector going forwards. In terms of the outcomes, whilst they weren't about ticking boxes by any stretch, both did train a lot of people, train lots of buddies and train lots of connectors, and the ripple effects there will be positive. So as Jenny says, as Amanda says, 32 buddies, and Jenny says 70 connectors. Those numbers are about what we'd expect for the schemes, considering the models and how they work in practice and what the training looks like. But it was fantastic to get that many people trained in the time that they had. And then, of course, the understanding that was generated through it. As you'll see here, increased understanding of the links between heritage and wellbeing locally. That was evidenced in both of the sites, in both locations. Both indicated that the potential that on an individual and on a community level that would contribute to wellbeing, and just the key success for both of them of embedding heritage in a social prescribing pathway. It wouldn't be an evaluation without challenges, it wouldn't be projects without challenges. And the top one, I mean, Taylor's old as time, that time is one of the biggest challenges. Both were 9-month projects, which were extended out to a year. And as ever, that's just not quite enough time to build those relationships, to develop these concepts into practice, and particularly with the number of organisations involved. You know, we all know that VTSE organisations in particular are incredibly low on capacity. So the time to do that in a meaningful way and engage with communities in a meaningful way, I think for us, that's the key, as well as in evaluators, the time to collect data, meaningful data that shows distance travelled is always hard over the course of a year. Added to that, the heritage aspect of the seasonality, which I won't need to say to anyone involved in nature in the room, but the same obviously applies to heritage. The flows of how that looks throughout the year has a massive impact on it. I'll skip over a little bit, but the last 3 points here around specifically how heritage has worked in this practice. For some people, it was just seen as too niche or not as a priority when meeting high-level needs. That was the feedback that some gave. That didn't mean it wasn't useful or valuable, but just something to consider when putting this into practice in the future. Negative perceptions of heritage, and again, barriers to accessing heritage, which I'll come on to in our recommendations. I'll jump through these quickly, but that top point there on addressing barriers to accessing heritage as a priority before commissioning any of this work mapping out, understanding the barriers, and then addressing them before putting any commissions in place was incredibly important. That included, transport barriers, cost barriers, physical access barriers, and even just the fact that it can be quite intimidating for some people. It's really understanding what that looks like in practice in those locations was some successes and also some challenges for both the schemes. I won't go through all of them because, as ever, funding, staff capacity, resources, I don't need to explain those. But the second to last point here, adopting a flexible approach to suit local needs and conditions. If anyone that's visited Nottingham or Frome, you'll know they're incredibly different places. Frome, a market town in Somerset, Nottingham, a very diverse and thriving city. The heritage provision in both those locations, really different. The social prescribing infrastructure, incredibly different in practice. So for scaling up either of these schemes in the future, putting that into practice, that mapping exercise was incredibly important, and took that. This phrase is trotted out many times, the place-based approach, but it couldn't be truer in these cases. And just to say thanks to Amanda and Jenny for supporting with our evaluation, our data collection. Thanks so much, Desi, as well, for your flexibility and support throughout. It's been brilliant to be involved with. Thank you very much. Just to add that you can read our full report, which is much more detailed, on the Historic England website. That's right. And questions as well.
Yes, we will be here for questions as well. And yes, all the toolkits, the WebHill report, the reports from the individual projects are on our website, and you can access these later, absolutely. And just to say, as toolkits go, they're not any kind of prescriptive models, like you don't have to follow them by the letter. It's more about sharing those learnings and findings from that. But all of these obviously have to be amended to suit local needs, like Meg just said, and that's the most important thing. Okay, enough from me. Let's go to our second presentation, which is from our lovely colleagues from Kirkham. I want to welcome Helen and Sue Flowers from Kirkham to tell you about the wonderful Wellbeing and Social Prescribing program there. And just to say, if you haven't seen their exhibition, which has been going on all day yesterday, and it's here today in that medieval beautiful corridor, and the Tate medieval kitchen just on the right from there. Please do take some time today to do that, because it's absolutely amazing. It's really beautiful.
Thank you, Desi. Thank you. I'm really delighted to be here. So thank you very much, and to be talking with my colleagues here from Kirkham. So my name's Helen Shern. I'm a consultant in arts, heritage, health and wellbeing, and I will provide a very rapid introduction with some preliminary findings from our independent evaluation, just to give context, and then I'll hand over to Sue Flowers, who leads the Phoenix Rising programme, and then our two participants, Hilary and Annette, who will speak about their experiences. So, in context, the Kirkham Heritage Health and Wellbeing Programme is a key part of Kirkham Futures, which is a historic England High Street Heritage Action Zone, and in partnership with Fylde Council and Kirkham Town Council. So this is a brief timeline. So March to September 2021, myself and Ferry van Dijk of FVD Consulting were commissioned to undertake a feasibility study. And then October 2021 to March 2024, which is the end of our programme, Phoenix Rising, led by Sue Flowers with Green Close, are commissioned in stages to deliver a programme of heritage health, heritage-based wellbeing and socially prescribed activities and events, art, nature and movement, initially as tasters and a pilot. I'm commissioned to advise and steer the overall programme and to be an intermediary really, and to sort of advise on the commissioning. The evaluation, Toby Williamson and Dr. Ava Silarova are commissioned to evaluate the programme as a pilot in 2022 and in the final year in 2023. So, the highlights from the independent evaluation. Overall, the programme was perceived to have been a success. One key stakeholder was emphatic in describing it as having overachieved. Improvements in individual wellbeing endorsed by participants and stakeholders. The evaluation greatly benefited from having 2 community researchers who interviewed 16 participants, so Annette York and Sally Bannister. And the University of Central Lancashire provided expert advice and training. There were challenges to the programme, including obviously the long-term impact of COVID. There are many more ones to talk about perhaps in the Q&A or afterwards as well, but for this, I need to move on. But we were delighted to have our programme and the pilot evaluation referenced in the Creative Health Review of 2023. So further preliminary findings around the key factors that contributed to the success. Being sensitive to what was already in Kirkham and the local views as the programme was developed, and embedding an ethos of co-production and community empowerment. The duration of the programme enabled an iterative approach, trying out different community engagement activities, etc. This is the wonderful A to Z map of Kirkham by Kremena Dimitrova, who co-developed this with the community, and there are lots of them downstairs in the exhibition. The next key set of key factors, some joint activities with the parallel cultural programme, the Cultural Consortium, also part of Kirkham Futures, and we commissioned them to produce the Voices Oral History project. Building positive relationships and partnerships with key individuals, venues and organisations in Kirkham who reciprocated with their support and enthusiasm, e.g. St Michael's Church, the library, the community centre, Grow Kirkham. And this is a leaflet which is also downstairs that was also designed by Kremena Dimitrova, which was necessary to promote and inform people about the programme. Another set of key factors, community wellbeing, qualitative community mapping data collected indicated that Phoenix Rising and the programme more generally had helped facilitate, acted as an impetus or catalyst for a number of new community activities, projects and connections. So we have the Wellbeing Festival, and in fact it was an inspiration for a project with the Restoration Trust last week in Norfolk with the Brecht Fen Rivers Partnership, which I was involved in. Kirkham is selected as a Greening the High Street pilot project. Green Close, i.e. Sue Flowers, are coordinating this with Grow Kirkham, so that's just about to start. The Stitch Together and the Space for Nature groups grow flourish from the programme. The film by Rachel Capovilla, which is also downstairs, is commissioned. Myself, and Sue are co-investigators in the research programme, National Partnerships to Tackle Health Inequalities in Coastal Communities in Blackpool Fylde, Hastings and Weston-super-Mare, which is part of that mobilising assets to tackle health inequalities major programme, AHRC, UKRI funding. So other set of key factors. So Sue Flowers is part of the phase 1 of that programme with Phoenix Takes Flight. I co-authored an article about Kirkham for the special issue of Wellbeing in the Historic England Research Journal in 2022 with Andrew Chatterjee, who was the regeneration officer. And this picture here is the sort of launch event performance of Cotton that we commissioned in the Market Square. In 2022, I presented the Kirkham programme at the Social Prescribing Show in 2022. And also the programme had a national profile which generated civic pride and confidence. So the final slide for me, and again, sorry, it's very rapid, but we also, another key factor was consultation, careful thought and planning as the programme came to an end to try and maximise opportunities for sustainability. So we have this wonderful illustration by Grace Collins of our Community Inheritance Project led by Dr. Cecilia Wee, and she has produced a report, and it was really obvious that people wanted to develop sort of further opportunities for intergenerational work and community wellbeing hub, Eco Hub. And then indeed that's influenced the current crowdfunding campaign that Sue Flowers has launched on the Space Hive Lancashire County Council initiative. So now I will hand over to Sue, and thank you very much.
Good morning, everyone. As a visual artist and the Phoenix Rising programme lead, I'll be telling this story through images as well as words. So I hope you can see the slides. So I'm going to talk about the Lancashire town of Kirkham and how we used its heritage to rebuild well-being as we came out of the COVID-19 pandemic. We did this by working with people to understand what art, heritage and well-being really meant to them, and to see if we could use our programme to ignite curiosity and build hope. Kirkham has a rich and diverse history, which its residents are rightly proud of, and it was a real privilege to be able to work with them for so long. Until now, most of it has been unacknowledged. The artist Ellis Lowry visited the town in the 1920s, and his drawing depicts St Michael's Church, one of the 5 churches in the town. This is St Michael's today. It now houses St Michael's at the bottom of the street. The actual church now houses a local history archive, and partly because of this, it became the epicentre of much of our creative heritage and social prescribing work. We wanted participants to be able to explore the heritage, but also to use creative processes to see it in new ways and maybe even imagine a better future. We started the programme by offering a number of pilot activities. We did not know whether people wanted to experience art, nature, or movement, or a combination of any of them. So we asked them, and our programme ran around these 3 core themes. The fine art of cookery involved exploring the development of healthier recipes, researching the history of ingredients, and also using artistic processes. And you can see us all there with our 2-metre gaps between the tables. However, with the pandemic drawing to a close, the official launch of the local history collection was marked by an event exploring Kirkham's Roman history. And as a way of studying the Romans, we collaged mosaics and cooked Roman breads. I do have to say they were rather chewy. And Kirkham was home to a Roman fort, and a shield boss was found there, which is now housed in the British Museum. So we might feel like we're a small, insignificant Lancashire town. The heritage isn't there, but it's isn't there in your face, but it's very much embedded in the community. We understand that people from a place usually know far more about its cultural nuances than anyone from outside of it. So we worked with and alongside members of the community. We wanted to unlock what interested each individual in the heritage of their own town, and collectively we made this map. Participants recounted their knowledge of former public houses in the town. Where there were once 26, there are now only 7. The copious drinking holes having sprung up to quench the thirst of the mill workers and weavers from the 11 mills which once stood there. For Kirkham was also once a major textile production centre, creating linen for sailcloths harvested from the flax fields nearby. It was a big ask, but we worked with and for people, rather than delivering work to and at them. And of course, we brought in professional artists and historians along the way, because we wanted to develop curiosity and inquiry. At the beginning of the programme, we undertook a process of being significantly present, a kind of meaningful loitering, which means listening, reflecting and observing to what mattered in the community. And after a year or so, we realised that the men of the town needed a more focused and a more specific offer. And so the Med Shed was born, developed and delivered by men, for men, in a shed on the periphery of the churchyard. We were able to nurture and support the development of the group as it came into being. A new growing space was established at the library. Heritage varieties of potatoes and other vegetables were grown, harvested and distributed to locals for free. Free, locally produced, healthy food, plant for local people. Plants became a source of inspiration, and a new wellbeing group, Space for Nature, evolved. And huge credit to Helen Lease, who led the nature programme for us. Following a keen interest, by visiting wildflower meadows, learning new skills and exploring wellbeing through heritage, individuals started to grow and flourish like the plants around them. And following a keen interest in the former textile industry of Kirkham, ignited by artist Danielle Chappell-Aspinwell, a new artwork, Kirkham's Golden Threads, was realised, and another new group, Stitched Together Kirkham, started to meet to support each other's wellbeing. And Danielle's textile pieces downstairs. The duration of the programme enabled positive community-led activities. And so as we came to the end of the programme, we wanted to do something extra special to reveal its rich social history and respond to a unique form of the town's intangible cultural heritage. On the second Saturday of June, an annual event, Club Day, is held in the town. The streets are closed to vehicles, people pour onto the streets and process with banners and brass bands. Now firmly adopted by the Kirkham's 5 churches, Club Day originates from the Friendly and Benevolent Societies, processing for and with the community. And so we worked with participants, some of them are here today, for 6 months to create a series of beautiful pennant banners. They are for Kirkham, made by the people of Kirkham. And it's a real privilege to present their work here today. The work is inspired by the history of the town, their creativity, collective interests, and their response to well-being. And I'll just finish on this one. We had planted seeds of hope, and with due care, kindness, dedication, individuals and ultimately the community began to flourish. I'd now like to pass on to 2 of our participants who will tell you about the programme from their own perspective. Over to you, Hilary.
Hi, my name's Hilary Ayling, and I'll just tell you a bit about myself. From 2016 to 19, I suffered the loss of a favourite uncle, then my much-loved nan, then my lovely dad, along with other friends. A month before Dad's death, in 2019, we moved from the town that we'd lived in for 32 years to Kirkham, where I only knew my daughter and her family. Then in 2020, COVID came, and tough things happened during that time, and they were hard to deal with. Through the lockdowns, I kept myself busy, and I wasn't without purpose, but I was feeling a strange disconnectedness, an ache. Other than family, there was no one that I met in Kirkham that I found it easy to chat with. I didn't know anybody. In early 2022, things changed. I joined the first of 3 of the Phoenix Rising groups that I've been involved with. During Stitch Away Stress, I met a wonderful group of people who had a love for creating, and as we stitched, I began to learn about the town that I'd moved into. We did research into the workhouses and the mills that were once there, as well as the Roman fort. I continued on to the second project, Kirkham's Golden Threads, where I was encouraged to explore the skills that I had and research the history of the town in the archives. I learned more about the linen industry that was once such a huge part of the town. As the Golden Threads project ended, I joined the Creative Heritage Explorers group led by Sue. I delved deeper into the Roman history of Kirkham and in particular the findings of an archaeological survey into a potential Roman bathhouse that is now hidden by the extension to someone's home. Yeah, I'd have had a glass floor, but anyway. As my love for Kirkham grew, so did my frustration that much of the history was no longer visible. So I decided to make the bathhouse and the fort as visible as I could. I stitched a wall hanging, which is there, depicting the bathhouse findings, and I assembled a cardboard model fort, which the children seem to like, apparently. As a group, we produced a map detailing the history of Kirkham through time and produced pottery and stitching expressing what Kirkham means to us. Recently, we have joined together to produce banners representing some of the things we consider important about our town and reflecting our bond as a group. I now feel a confidence that I can attempt more than I ever would have done in the past. I have some wonderful friends that I care about a lot. I now feel very much connected with Kirkham and have joined Kirkham Cultural Consortium to help promote a feeling of belonging by arranging creative events such as the recent Heritage Lantern Festival. I feel a sense of belonging, and that strange ache has gone. I am very grateful for all that has gone on through the Phoenix Rising Wellbeing Project. I'll now hand over to Annette. Thank you.
Good morning. My name's Annette York. You've heard my name quite a few times. I've been shocked at how much I've been doing. Well, for many years after a major trauma, I was still stuck in a deep rut, reliving the past. Nothing seemed to work for me. Then I joined the Heritage Explorers group run by Phoenix Rising. They didn't need me to revisit or replay my trauma. They just quietly loved me, showed me new skills. For example, designing a textile. The Roman there is some of my work. Yeah. And such things as the banners. That's on one of the banners, so please go and have a look at them down that corridor. They are all absolutely amazing. And I feel valued in a way I've not experienced before, and I'm moving forward with my life. Phoenix Rising has helped me to clamber out of that very deep rut, and to them, I give them a thanks from the bottom of my heart. Sue Flowers asked me if I would do some evaluation interviews on the work of Phoenix Rising. I would visit other groups and find out what they felt about the programme. Interviewing the different groups gave me an invaluable insight into how each of them worked and the diverse range of activities they carried out. The dance group started out as chair yoga, but as their muscles and ligaments started to stretch and work again, they moved on to interpretive dance, a bit of which you've seen on here. One lady told me, "I have now regained my balance, and as a result, I'm far more confident about going out." That was from a lady who had spent the last 2 years stuck in the house. So that was a massive improvement for her. The men's shed, set up to encourage men to talk more, has been steadily growing in numbers, and they have undertaken several projects around the town. One man said after his first visit, "It's the group I didn't know I needed." Another said, "It stops me sitting at home and watching the TV all day." The nature group has been learning to cook seasonal food. And they've written a cookbook, of which they still haven't given me a copy. But I'm eager to try their recipes. Many told me how they've begun to feel less isolated and more involved with their surroundings. Lots of people have learnt new skills and found confidence in life that they had forgotten they had. However, there is a downside to this. All this excellent work is that the funding has now come to an end, and some of the groups will not be able to continue. So what was being achieved so far will sadly dwindle away. I hope we can find a way to secure funding for the future, as it will be a shame for future people to lose out on the excellent work done by Phoenix Rising so far. Kirkham is becoming a wonderful, vibrant town again, and I am looking forward to seeing it thrive well into the future. Thank you.
Absolutely amazing work at Kirkham, and hope it continues. Thank you all for being patient. Please just stay here for a few more minutes because the last presentation for today, Barnley Bath, is absolutely amazing. And the reason we're late is the technical issues and my own delay with the first presentation. So I'm really sorry. Please welcome David and Jenny from Bramley Baths. And thanks for bearing with us.
Good morning, everyone. Thank you, Desi. We are from Bramley Baths. I'm Jenny Willits, and let me just bring the slide up. That is Bramley Baths. So we are an Edwardian, last remaining Edwardian bathhouse in Leeds, and we are fully functioning. There we are. That's me and David, in case you were any confusion. So we are the last remaining Edwardian bathhouse in Leeds. We offer full service provision. So we do swimming lessons. We offer swimming as just for general swimming. There's fitness classes. There's a fully equipped gym as well, which is of the best quality equipment as well. So yeah, it's just a wonderful, wonderful place to be. And I always think I'm really, really privileged to be able to work there because it is just a wonderful service to offer. So the service provision that we offer is highly, highly trusted by our local partners and organisations. Lots of local charities and other local organisations use us as service providers because we are trusted within our community. Our community uses on a regular basis for, as we've already established, a really, really broad variety of services. We've got over 1,500 people a week learning to swim. That's right from babies through to adults with school lessons and everything in between. And we've got fitness classes as well, again, supported by the community as a service. Yeah, so move on to the next little bit. So I'm here really to talk about two of the projects that we have recently come to fruition, if you like. So our first one I'll talk about is our CEV project. CEV stands for Clinically Extremely Vulnerable. So throughout the pandemic, there were obviously people that were told to shield throughout that time. So they weren't able to go out, they weren't able to socialise, they were told very much to stay indoors, and because they were just that clinically extremely vulnerable. So our project came at the end of that towards 2021, where they were then allowed to leave the house and allowed to come out and socialise. Obviously, some people were really, really eager to sort of integrate back into society. Some weren't. Some were really not ready because they were really, really frightened. So the project aim was to really listen to everybody's individual stories. It wasn't really about us telling them what they thought, what we thought would really benefit them, and we might be aware of their medical condition and we might think that would really work for them. But actually it was about really, really listening to what they wanted and really getting to know them. So in the initial stages, we invited them to come to the baths, or we invited to speak to them over the phone, just to get a real sense of it. And I think I was the one that they initially spoke to, and it was that real in-depth listening that really contributed to their health and their well-being, and just really getting to grips with what they wanted, and not, again, trying not to tell them what they wanted. Once we'd established what they wanted, i.e. was it just a little bit of help getting back into exercise, were they not ready to integrate into a class, do they need one-to-one support, that kind of thing, we would facilitate that at their pace, whatever they wanted. We even had spaces within the pool where they could have the pool to themselves, which was obviously a real treat for anyone, but if we could facilitate that, we would do. So we offer them 5 free funded sessions, one-to-one basis if they required that, or also just within if they were ready again, into a general swim. Some of the results were unbelievable. So out of the whole, the amount of people that came, that about 70% of those people continued to exercise after that initial what's the word I'm looking for? Initial meeting, shall we say? Triage, yes. So yeah, that was really wonderful, and it was really good to see from that initial meeting when some people were physically almost within themselves. It was really, 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 yeah. It was just, they've been shielding for 2 years. They couldn't leave the house, so we were able to do that because we were lucky that our health allowed that. So to see them go from physically being like this to sitting upright in our final meeting, and for them to describe it as they felt like they'd won the lottery, was unbelievable. But we literally given them 5 sessions and a membership for 2 months, and then it was up to them to continue their journey. And it was wonderful to see how we could just really help that one individual person just to thrive within that, if you like. Our second project was called the Big Bramley Apple, and that was more of a collaborative effort between ourselves, another local charity called Bramley Elderly Action, and the local GP surgery, Bramley Health and Wellbeing Centre. And initially, the GPs would identify people that would benefit from healthy activities and just social activities as well. So they would send out a letter that was headed with the NHS. So they knew it would come from their doctor, so it's definitely going to be really good for them to attend our sessions at the bath. And we could offer them a free swim or a free gentle exercise with a social element after as well. That project saw over 100 participants come along. We also took out the barrier of transport. We offer people transport literally from their door to the bath, which was really useful. Because as we know, people that might struggle with mobility might also struggle to get on a bus, or they get a taxi would be really expensive. So yeah, being able to offer the transport element was a really massive part of that project as well. Again, wonderful, wonderful outcomes. We had a gentleman that came that had recently lost his wife. And initially he was very much, I do not want to go to these socials. I don't need a. I'll just come for exercise in a very broad Yorkshire accent. But he actually said, "Oh, go on then. I'll stay for a cup of tea, but I'm not staying long." That kind of thing. I'll have a biscuit and go out. And eventually, the biscuits were a pull-in there. But after they'd done gentle exercise, but we don't talk about that. So, but yeah, he eventually really came around to that idea, and he ended up staying for the socials, and he really made new friends groups, and he still comes to the swim sessions. So again, like somebody just said, which is brilliant. I love that. It was the group that they didn't know they needed, and I thought that was a brilliant quote. Well done, very good. So as far as social prescribing and the pathways to access, both these were very much endorsed by the NHS as being a trusted provider of the services that we do. They were able to refer into the projects that we do, knowing full well that we would deliver that provision, because we are an excellent provider of the services that we do, and we do pride ourselves in that. We've got an excellent staff team with experts delivering day in, day out, and it is really a wonderful, wonderful place to be. So on that note, I'm going to pass over to our wonderful CEO, David. Thank you very much.
Thank you for us being invited, Bessie, to speak at this event. A few key things. With the Big Bramley Apple, we did measure on the Edinburgh and Warwick scale about mental well-being. And essentially, we had one lady who came along who had terminal cancer, lung cancer, and she measured sort of 28 out of 33. And we did a happiness score. Bramley LD Action have developed a happiness score of 1 to 10, and she was about 6. So after the sort of 10, 12-week intervention, she became fitter, healthier. She went up to 32 out of the 33, and she went up onto 8 out of 10. She's still got terminal cancer, but her whole outlook on life is fantastic. The funding ended on the Big Bramley Apple. We're doing evaluation and things. But in essence, we kept a swimming session on, which last week there were 33 people coming along that we're doing for, instead of our normal £5.50, £6, it was £3.50. But the co-op have subsidised it, so we can keep it at that for the next year. So I just want to talk a little bit about redistribution of the funds. You know, the economic climate we're in, it doesn't matter if Labour get in, there's still going to be no money. NHS will go bust in the next 3 to 5 years if the 45 to 90-year-olds don't start doing something about self-care and looking after themselves. The speeches and presentations we've received the last couple of days are precious, but one thing worries me when people say, we're doing it for nothing. No, you may be getting a grant from culture or heritage or whichever sphere of funding. The government or the new government will be raiding those pots. Those pots will diminish. If anybody thinks they're going to be bigger, they're not. If they're going to sustain the same level, they're not. So we're a social enterprise. We came out of the council in 2013. The Baths was losing £300,000 a year. We've now turned it into making circa £200,000 a year surplus. We call it surplus for purpose, not profit. Profit isn't the rude word in the voluntary sector, charitable sector, which most of us are in. The luxury of not being able to charge will not be there in the future. The difficulty with projects where they were free because you had a grant, it is more difficult. I've been in the sector for 18 years now to start putting a charge in after that. So what my sort of word of advice is, start with 50p per session at least, and then you can incrementally move it up over a period. But the hook of the heritage, the building we've got is superb. It's a real sort of uplifting. You go in the building, you see the stained glass windows, sun coming through the lantern. It's just a great place. We've done stuff like Leeds Light Night. where we had 450 new visitors, where we had the pool full of smoke. There were lights everywhere. We had 10 lifeguards on instead of the 2 normally. But in essence, there was a Danish artist on the balcony orchestrating a live picture, but it was like the people in the pool were part of the picture. You know, it's sort of a really, really good. There are some things on our website if you want to have a look at that. The other thing that we've done is create an impact report, which people who are going to be funded in the future have got to prove their worth. You know, there's a lot of people, economic, social sort of value advisors in the room and things. Prove your worth, because NHS will say, oh, it's non-clinical, it's people doing good, yeah, great, but it's not proven clinically. A lot of the things in the NHS are not proven clinically either, but that doesn't matter because they're at the top of the pecking order for the money. Part of realising community assets 16-17 we did with the CCGs, it caused the primary care networks and all the new sort of ICBs and things, and where the money's going to distribute from. What we want is a movement for this sector where recurrent funding happens and a prescription is written out for people to come and do some things in the heritage. Some of the wonderful things that have been described today. But if we're also saying we're part funding it, then that's a powerful argument to the NHS and to other people. In Bradford, we did get the £800,000 that went to GPs when 5 years previous, the GPs were almost spitting in my face saying, you're not touching our budget. £800,000 came across to the voluntary sector. And the GPs were getting about 100,000 value because they had what you call failure demand, because they're trying to get people to go 2 buses to go to a diabetic nurse in a place that they didn't live. Then the VCS got in, did it on a local basis. They got £3 million worth of value. They did prevention and got people who are going to be diabetics in the future started to attack it from a prevention point of view and not trying to cure things, which is far more expensive. So other things about the bath, we are called the friendliest baths in the country. I think we're the friendliest baths in the world. Everybody's got a smile on the face when you walk into the place. If you're in Yorkshire anytime, please do come along and have a swim. We did another thing on the solstice. We had a 5:30 swim when the sun came up and things, and that was really well attended. You know, because the whole sort of place is good for your mental health. We got quoted in the Rutledge Handbook of Intercultural Mediation, and that speaks for itself there. The sort of emotional tie and the commitment to the space, and that echoes with some of the archaeological projects, some of the house projects and things we've heard in the last 2 days. That really does resonate with people. You know, we've got a yoga instructor who doesn't deliver at the baths, but she comes along twice a week because it sets her back into the mode for delivering her yoga and stuff like that. So, you know, we've got a real sort of jewel in the crown. It's a community asset. It's a community hub. It's doing things in the community that 3,500 people a week are benefiting, plus more. We've just gone through the EOI stage of Heritage Lottery because we've got to make a surplus because we've got to spend about £3 million on the building in the next 10 years. We've now been accepted for the development stage. So that is fantastic. So thank you for listening.
We have got a video, if you'd like to show it. Put it on a USB.
All right, just to say, if somebody has to go to a workshop in the other rooms, which starts 11:15, please go. Sorry for keeping everybody, but those of you who are staying here for the next session in this room will start a little bit later, so you'll have time to nip out and get a cup of tea if you want. Meanwhile, oh, sorry, I just... Get back in the room, please. Hi, everyone. Thank you for joining us again, and sorry for the slight delay. But we will continue this next session, dedicated to heritage mental health, actually with our second speaker in the program, Helena Garcia Carrizosa from the Open University. Our colleague Laura Hamdan unfortunately couldn't be here with us today. She had an emergency she had to attend. So it worked actually with obviously the overrun we had for the first session. So thank you for your patience, for your flexibility. And Helena is joining us through Teams. She couldn't be here personally. So I will pass over to her. And if it's okay, Helena, I'll try to move your slides from here. But if you prefer to share yours, do let me know.
I've attempted to put the slides up. I can't see if you can you see them?
I can see them. Just a second, because I can't see them on the screen for some reason. So, okay, what am I doing wrong, guys? I don't know. Okay, well, we can see you now on the screen, so that's good. Let me just try to move the slides, Helena. It might be better if I move them then, if that works. Yeah, is that okay? I'll move your slides and you can speak to them.
Oh, right. Okay.
Sorry,
Great.
it's just a lot of technical, few technical issues today. I think this will work. I hope so. Okay, so over to you, Helena.
Hello, everyone. Thank you so much for inviting me to share with you my findings today on mental health and well-being, potential afterthought of a four-country participatory research project in museums. I'm a PhD student at the Open University who is putting the thesis together based on an extensive research project. So if we go into the next slide. Right. So I'm going to start by a quick introduction, painting the picture of the project, what it entails. I will then go into sharing with you the research questions that I've imposed myself for this particular conference. I will then talk about expectation management and whether and to what extent it might have gone wrong. Then I will discuss about the contributing factors to mental health and well-being, following by technology, whether it was an enabler or a disabler in our case, and finishing off on my reflections in a post-pandemic world and whether we could redo this big project the way we did the first time around. So on to the next slide. Great. The project is based on ARCH's an EU-funded Horizon 2020 project. ARCHES stands for Accessible Resources in a Cultural Heritage Ecosystem. It was a project that started in 2016 and finished just in 2020, at the start of 2020. It consisted of 14 consortium members, 6 museums. The museums were based in London, the Victoria and Albert Museum, as well as the Wallace Collection, 2 in Madrid, the Thyssen-Bornemisza and Lázaro Galdiano Foundation, then another small regional museum in Asturias in Spain, and the 6th one was the Kunsthistorisches Museum in Vienna in Austria. The other companies or the other partners were 5 technology companies. Were 5 technology companies, 2 universities. One of them was Open University, the other one was Bath University, and some marketing and social media companies. The project recruited 212 participants across the 3 countries and the 4 cities that I shared previously, and they consisted of participants with different access needs and preferences. We predominantly looked at disabled participants who had access needs and preferences with visual, as well as hearing and learning difficulties. The participants were recruited and started to recruit it in 2016, but really the work with them started in 2017 and ran for about 2.5 to 3 years until 2019. The participatory groups met on a bi-monthly basis, so every 2 weeks, which meant it was quite intensive. This is quite important to outline as it shows the different relationships and tensions that came as a result of that. So the next slide, please. Here are some of the research questions that came into mind when I started researching for this conference. Especially interesting for me was the expectations and expectation management, and the different factors that influence the well-being of the different participants. It must be outlined that for the project, participants were not just the 212 that I disabled people, but also we considered staff to be participants. Of course, that in itself brought a lot of different tensions that maybe it's for another time. We were lucky enough to complete the project just before the pandemic, but we're wrapping up and finalizing the dissemination just when it all came out, which made us really think, could we have done this in this world? Which is one of my research questions as well. Okay, let's move on to the next slide. It's just a brief quote, really, around the importance of expectation management when it comes to participatory research at all the different stages and how it can affect the relationships as well as the ultimate success of the project. We just go to the next slide. So these are, I've identified these 4 stages as through the project where expectation management could have been done better. From the start, the project was put together very quickly prior to the launch. I'm sure a lot of us are very familiar around the process of trying to meet deadlines, and if we have, in this case, there were so many consortium members in so different places around the world with different languages. It was quite done in a rush, and that in itself meant that not everyone had understood key definitions, roles, and responsibilities. Afterwards, I found out that some colleagues hadn't translated the proposal, which was in English, into their native language, which obviously meant there were some lost in translation moments, which had an echo effect to the participatory project. So from the get-go, it would have been important to have established these very very much. So then in the open house events, so when we started to recruit participants, we had a series of open house events where we explained the project, and the language that was used around the project gave perhaps false expectations of what the project would be. The participants expected, okay, this is the European funded project, multiple millions are involved, perhaps we will be able to travel to Spain for a session, visit museums. The reality is that the project was not able to do that. It didn't calculate with some of the participants' needs. And the conversation around mental health, well-being, and the impact that it would have on the participants was not there. This had afterwards a knock-on effect that I will share with you. Midpoint through the project, it would have been useful, given that we had participants for almost 3 years, to have a sort of check-in to ensure that participants still understood what was expected, what their roles were, how they might have shifted from the start, and what staff were happy to do and what staff were not happy to do. This would have enabled and facilitated the dissemination phase later on as well, when participants had hoped to have a final event somewhere across Europe. We go on to the next slides. Thank you. So I have outlined on the right a diagram with the different tensions that kept moving around us as participants, and the knock-on effect that had on the well-being. Ultimately, they all had to do in some way with power in financial power, but also in relationships, representation, and these tensions had a very big effect on the well-being and mental health, not just of the disabled participants, but also of the staff. There was never a conversation of mindfulness, of how to support each other in that sense. We did have a lot of ways of working documents on ensuring that whatever we captions in videos, as well as large prints, but we never actually discussed, should we have a well-being check-in or anything alike. We had a lot of conversations around participants feeling undervalued, taken for granted. Yes, they were volunteers. For many reasons, we were unable to pay them, but they got reimbursement and they got loads of benefits, such as memberships for free for museums, transport reimbursement, free lunches. However, participants still felt undervalued. So the conversation and tensions around well-being and mental health were very much there, just not labeled like that. And the conversation for and amongst staff's well-being and mental health only arose during the dissemination phase, quite at the end, once we had to make decisions for around what participants we could include for what dissemination events across Europe. I'm very conscious of time, so I'm going to speed up a little bit. So technology at its best. The project was aimed ultimately at ensuring that were accessible resources in museums. Resources were understood to be technological, but actually at the end, technology failed us and failed the participants. We had a very wide range of demographic We had 18-year-olds to 75-year-olds, and the experience of technology was quite varied. We had a few participants that came from different cultural backgrounds, where technology was very much restricted to them by their by male figures in their families, and for religious reasons they didn't know how to use the internet, and this all made this solution, which we had designed a technology as a form of communication, much more difficult. And the knock-on effect meant that we had to often repeat ourselves, creating frustration amongst participants and staff. So technology also wasn't catching up as quickly at that time as we had hoped. It was very much limited to it. Some museums didn't have Wi-Fi when we started working, so it was an enabler, but also a disabler, which created a lot of impatience among participants. Right, final slide. I have 2 minutes, conscious of that. So in the post-pandemic world, I don't think we would have been able to do this project. We would have had from the start to have discussed the well-being of staff as well as participants, and would have had to separate well-being and mental health from the actual disability. Even though they might be very interconnected, we shouldn't have been this assumption that, oh, maybe it's just her reacting to it negatively because she can't see it very well, but maybe it was anxiety. We should have had more open conversations around that. And really, the pandemic was a great as terrible as it was a great opportunity for these conversations, as we cared about ensuring that people were engaged in society, and through creative ways. It did open up also opportunities for technology companies to speed up their developments and think creatively. Museums had to venture outside of their halls, which also meant more creative opportunities. But the project as it was designed could not have been done today, and it's a good way in many ways as well. It becomes a good lesson learned. Right, I think I'm on time. Thank you so much for holding on to me through this time. This is my email address. If I ramble too quickly and you have any follow-up questions, please don't hesitate contacting me. I'll be glad to organize a quick chat. Thank you.
Thank you so much, Helena. That's brilliant.
No problem. Thank you.
Wonderful. Thank you so much. I will leave this meeting with you, the Teams meeting, but I'll rejoin for Q&A after the third section, if that's all right.
See you then. Bye.
Thanks. Bye. Thank you very much. And I will go straight to our next speaker, who is Will Rathaus, and he'll talk about mental health archaeology, the limitations and risks. After that, we can have more time with Q&A with both Helena and Will.
Hello, everyone. I'm Will. I worked in the past for Mind Aberystwyth, where I conducted what I believe was the first ever mental health archaeology project in Wales. And also more recently at Mola, where I delivered some of the earliest developer-funded archaeology projects with other colleagues who are here today, but not in the room with us right now. See if you can catch up with Katrina Gargett and Aisha Purcell to find out a bit more on that. I was going to be presenting this with my brother, Robert Rathaus. Unfortunately, he couldn't make it here today. He's a senior occupational therapist in a psychiatric intensive care ward, and he was needed for work, unfortunately. So this paper proposes a couple of areas for future research. In particular, but let's just sort of look quickly at the background of this area, because really since 2012, projects using archaeology to support mental health have been run. First, you had Operation Nightingale and the Past in Mind. Since then, you've had a whole lot of other projects building on those foundations, including, of course, Human Henge, Mind Aberystwyth Small War Memorial Survey, Waterloo Uncovered, the Older Londoners project I did with the Thames Discovery Programme, Curious Minds, the Well City Salisbury project from Wessex Archaeology, and many, many others. Projects have also been run overseas, as we have Operation Nightingale for veterans in the UK. So the US has American Veterans Archaeological Recovery. And there's been some really exciting work done with Indigenous communities in British Columbia by David Shape and his colleagues. But if we're going to talk about researching the effectiveness of these, we've got to talk a bit about evaluation. Now, we all expect that projects with receipt of grant funding and indeed developer funding are going to be evaluated. You have to demonstrate that you're providing value for money. Evaluation data comes in two principal forms. We've got the quantitative data, a numerical value, which is most useful in showing average change across a group. Its weakness, especially in small groups, is that it can be affected by other incidental experiences people are exposed to. We can't sort of separate out the effects purely from what we're doing in isolation from everything else in a participant's life. Qualitative data, on the other hand, comes in words and includes narrative data which can demonstrate the reasons why effects are experienced. I would argue that a robust evaluation process ought to include both kinds of data. Quantitative data can be gathered using a wide variety of means. I've come across at least half a dozen in my time. The UCL Museum Wellbeing Measures Toolkit uses a particularly good visual interface in which respondents circle a number in the coloured umbrella that you can see on the left there. Right, sorry, right, my left. However, that system is seldom used outside of the heritage sector. And I feel it's very important to be able to cross-compare what we're doing in the heritage sector with what other people are doing in other areas. And for that reason, I've tended to favour the shorter Warwick-Edinburgh mental wellbeing scale on the left-hand side, which is used across a wide range of projects in many different sectors. Qualitative data can be gathered orally or in writing and could be presented in a number of ways. We've got a little word cloud in the middle that's one way of presenting that data. I would argue it's very important to formulate questions used in qualitative research very carefully and to really encourage the participants to be as critical as they can be. For example, in the War Memorial Survey, we really wanted people to tell us how things could be done better. And we got responses including, in terms of how the project could be improved, I feel further outreaching to prospective participants would help. Many of those who joined us towards the end of the project expressed regret at having not come aboard sooner. And I feel there are others among Mind Aberystwyth's clients who would feel the same way. So please do, if you're designing your evaluations, please encourage criticism. Now, this is where my brother was going to really shine. One of the things I think we need to address a little bit is the extent to which the diagnosis might predict how effective a heritage activity might be in improving mental health. There are, of course, a wide range of mental health conditions. I've listed a few here. Government figures from the National Institute of Health state the most common conditions are depression, anxiety, panic disorders, obsessive compulsive disorder, and post-traumatic stress disorder. Now, over here, I've sort of divided things up into mood disorders, which are diagnosed when feelings and emotions become out of control and start to impact seriously on a person's ability to live a comfortable and fulfilling life. Perception disorders involve full sensory input, for example, hearing voices or seeing things that aren't there, i.e. audio and visual hallucinations, and or problematic ideas or beliefs, for example, a sense of being watched or that people are out to harm you. Some disorders involve both perception and mood problems, for example, bipolar disorder and body dysmorphia. Other problems affecting the mind can also include dementia, learning difficulties, addictions, obsessive compulsion, and autism spectrum neurodivergence. I haven't got time to talk about each individual listed condition, but I would recommend reading the Mind website via the link shown over there to get some more details on those different diagnosed conditions. So we're also interested in how severity of conditions might affect outcomes, or also how we run projects seeking to address those conditions. So we'll just go through this graphic quickly here. You can see that stage 1 or level 1 mental health condition doesn't demonstrate a great impact, but does display identifiable signs of problems. Stage 2 involves regular symptoms which do interfere with activities and roles of daily life. Stage 3 involves serious disruption to a person's life. And stage 4 involves persistent severe symptoms which may cause the person's life to become at risk. In rare circumstances, the person may also present a risk to others. Which leads me neatly on to talk about how people's attitudes to mental health have really need to be reconsidered in some cases. The Time to Change Attitudes to Mental Health Illness Research Report, which is available online, showed that over a third of British people assumed that people with mental health problems were likely to be violent. In actual fact, research has shown that people with poor mental health have been shown to be at greater risk of being victims rather than perpetrators of violence. In particular, the largest danger to people living with mental health conditions is that of suicide. It's far more prevalent within that demographic of people living with poor mental health. Which leads us on to consider how the projects that we run with seeking to improve mental health through heritage interaction can go wrong. In what ways might our projects end up doing more harm than good? One concern is that the participants' mental health could get worse. That is, they could sustain psychological harm from their experience. Now, one way in which this could happen is in a post-project downturn. Now, this was explained to me by Dermot Walsh, who was one of the original people in Operation Nightingale. He explained that people had been taken out of profoundly distressing situations and put into these fantastic projects where they were doing fulfilling work with like-minded people that was really supportive. But then at the end of the project, they were straight back where they started. And having experienced that way in which things could be better, to have that suddenly stripped away might actually cause them to be in a worse situation than they were when they started. In some cases, participants might find experiences associated with the project a bit too much, an overload, or aspects of it triggering. In the book on Operation Nightingale by Richard Osgood, he mentioned that the book's called Broken Pots Mending Lives, highly recommended. Richard Osgood remarks that contrary to the fears, some people on Operation Nightingale might have problems with excavating skeletons. And actually, this is something Dickie brought up to me as well. In actual fact, it wasn't the case. Dickie told me about a situation on the World War I battlefield of Bullecourt, where veterans and serving personnel actually kept vigil overnight with remains of a fallen soldier that they had found prior to that skeleton being excavated and taken for reburial. We've also brought out concerns that behaviours by some participants might be triggering for others. Now, I've never seen this happen on a heritage wellbeing project, but I was involved in an ecotherapy project in West Wales, where one participant decided it was an excellent opportunity for a bit of naked sunbathing, which would have caused problems for some of the other participants if my colleague hadn't caught him and persuaded him to get dressed again. There's also other potential hazards. One thing that Dermot brought up again was dependence. He mentioned that he had seen some people going from project to project without gaining a great deal of more independence through participation. We want our projects really to be transformative. One accusation that has been levelled at community archaeology projects across the board is that it uses unpaid volunteer labour to do work that should be left for professionals, that is exploitative. The assumption is problematic on two bases. Firstly, community archaeology work almost invariably focuses on archaeological features that would not be investigated by paid professionals. There just isn't the funding. Secondly, the argument that archaeology should be left to professionals could be seen, or definitely is, in my opinion, exclusionary and as such problematic in and of itself. As archaeological sites can also present other hazards. I've worked on sites where asbestos has been present. Other sites have been exposed to raw, albeit diluted sewage, and animals likely to be vectors for diseases such as leptospirosis or Weil's disease. Some archaeological sites contain trip hazards and sharp objects. Working out of doors may also involve exposure to adverse weather conditions, where a mental health condition involves inclination to self-harm or risky activity, such as some personality disorders, body dysmorphia, to name but two. Extra care will also need to be taken to ensure that participants diagnosed with or believed to be prone to such conditions remain safe. So what are we doing about this? How are we addressing these concerns to make sure that the projects that we run are safe? Paul Everill and Karen Burnell undertook a research project jointly hosted by Winchester and Solent universities to identify best practice in heritage wellbeing projects. They conducted a consultative process with project organisers, participants, mental health specialists, and others. The Amphora guidelines that they produced present a robust and well thought out set of guidelines for running such projects, along with guidelines for people coming in as participants. We hope further research will assist in adding ideas to these guidelines that can further assist to ensure the best outcomes for participants. So in conclusion, when we design heritage wellbeing projects, we need to remember that people with the same diagnosis may present very different signs and symptoms, and that the same individual may present differently in different episodes of poor mental health. We hope to see more assessment of the needs of individuals participating in projects. We, of course, live in a time when mental health is in short supply. Wars, economic stress, coupled with rampant inequality and high unemployment, are strongly associated with poor mental health. Attitudes to mental health have indeed improved in the last few decades. Poor mental health is much less stigmatized than it was. However, promises to fund mental health care as well as physical health do not appear to have fully come to fruition, and more needs to be done. We believe that heritage-based activities are not a panacea, but we believe they can make a significant contribution to improving the situation for a great many people. We want to see more research being done to establish how best to tailor practices to cater for different conditions and severities, and to build a research base on the extent to which those conditions and severities might indicate outcomes for heritage-based interventions. Thank you all very much for listening. I'll hand back to Desi before we go for some questions and answers. Thank you. Shall I stay here?
Yeah, please stay here. I will join the Teams meeting with Helena in case you have questions for her. But please, if you have questions for Will, go for it while I do this.
From your point of post-project
downturn, yeah.
Isn't that a universal problem with the funding model we have in this country with everyone wants shiny new clothes, so they don't really care about what happens to the participants on existing projects? How do you get that across to them, the importance of that continuation? Because you can't prove that somebody is going to fall apart after the project.
No, you can't. Well, as the previous speaker mentioned, I think it's very important to think about the expectations that you raise. If you're going to run a fixed-term project, you can't sell it as being an ongoing project. Even if you do have a project which has links in to maybe a related or maybe overarching ongoing project. And this is something we had very much at MOLA, where we had the ongoing Thames Discovery Programme and people coming in to do wellbeing focused roles associated with that were offered the chance to come and volunteer on that project after the end of the specific wellbeing project. I was still careful to sort of say to them that at the moment, we have funding to carry on this project, this border project. We can't guarantee that's going to go on forever and ever. And indeed, the Thames Discovery Programme has had to contract quite significantly over the last few months following an ending of funding. But it's still being sustained by MOLA, and we look forward to there being a rebirth of that. I think that's one way in which we can address that problem. The other way is when you've got fixed-term projects, to really design them in such a way as to make them really transformative. So, or link them in to other projects, which will then pick up from there to further boost that transformative experience. So, for example, if you've got a project that's perhaps using GIS software with an idea that the participants can use that skill to enhance their employability going forward, then there needs to be, for example, say a career counsellor who can actually help them to use that going forward. I hope that's addressed those points. Thank you.
Brilliant. Question for Helena, or another question for Will, maybe?
Yeah, well, you mentioned the proposed model for
Microphone,
evaluation. Thank you. What was that model again?
So I don't think I really talked about a model of evaluation, but the two main varieties of data. And I'm a great believer that you need both the quantitative and the qualitative. Unfortunately, I think we do live in a world where the quantitative is prioritized. It's easier to sort of number crunch for people who are looking for measurable benefit. And the qualitative is open to sometimes being dismissed as anecdotal evidence. Whereas the quantitative, being a sort of average across a large number of people, is more convincing on that score. But I think the qualitative data really helps to confirm that the change you're seeing is as a result of the activities that people are engaging in, and also that to explain how those changes are being produced. Because I think it's a lot easier to have faith in something that's being transformative if you understand the process by which that is working. So I think both of those data sets need to be included in a robust evaluation. That's my argument.
Helena, would you like to share your view on that question? You're muted out, just unmute yourself, sorry.
That's classic. I definitely agree that quantitative seems to be the more sexy evidence, especially for funders and funding bodies. They prefer to get those numbers. There other issue that I think often happens with quantitative qualitative data is that words are open to interpretation. So there is often this perception that it is to a certain extent also bias. This is something that needs to be considered in the context in which we're showing the evidence, I think.
Thank you. Linda? Just a microphone. Another question.
I will, thank
Hiya.
you. That was really helpful. I think it's really healthy and helpful to have that kind of overview about what some of the risks and challenges are, actually, because it's the thing that we find hardest to talk about when we're trying to sell ourselves to kind of outsiders. So I found that really helpful from both of you, actually. I just had a really specific question for Will, which is WEMWEB's, the short Warwick Edinburgh survey. Have you ever had any interventions with, where you found that a difficult way to evaluate? And I only ask that, I can be honest about why I'm asking it, because we ran some projects a few years ago, and in the end, it just wasn't appropriate for those participants to give them even a form that looked official, let alone something that asked questions about mental health. And since then, I've been really uncertain about when that's the right thing to do and when it's not the right thing to do and how you evaluate that. So I just didn't know if you had a little bit more kind of insight into the WEMWEB's approach.
Well, I feel I've been very much on a learning curve with this through my career over the last sort of 8 years or so. The warm moral survey I did with Mind Aberystwyth, we used the full Warwick Edinburgh scale, and we did it at the beginning and at the end of every single session, which was, I know that someone's just pulled a face, which is absolutely right. There's no way I'll consider that now. But no one complained. Everyone happily did it. And it did provide some interesting data looking at the changes through sessions. Definitely, more recent projects, we've sort of used it maybe 3 times for the whole project, once at the outset, once at the beginning, once at the end. I think it's important actually to adopt a more longitudinal study and carry on doing those assessments after the end of the project to look for that end of project downturn and establish the extent to which something's been truly transformational. But one thing I did experiment with at Mola, which I sincerely hope I'm not going to confess to doing something bad from the point of view of copyrights, is I basically took the UCL Museums Wellbeing umbrella thing, and I got one of my colleagues to slightly rework it so it was generating the data from the shorter Warwick Edinburgh scale. So I found that worked probably rather better. That point of the sort of official style forms, I think it's a really good one, and I think that umbrella style visual interface is a really good way of doing it.
Thanks, Will. Laura and then Nicola, that's all right.
I just wanted to make a comment that one really good thing about the Warwick Edinburgh is that there is the hacked social value calculator, which is quite well validated, so that you can then put the data in and you can get a sort of reasonable number about the social value that you brought to participants. So that's, I mean, in hands you can get, and that's quite persuasive. Sorry. That's all right.
Hi, I'm Nicola Henry. I'm the head of excavation for Historic England. When we run projects of this nature, we don't always go with those formal evaluation techniques. Sometimes we find it better to sit down with each person at the beginning, ask them what they'd like to achieve from the project, ask them if they have any particular interests that they'd like to develop. If we can make that happen during the life cycle of the project, that's great. Meet with them at the end to see if we've managed to achieve any of those things. That requires investment. That requires me and someone else sitting down with every single person. It's not always possible.
I definitely agree. That's a really good way of doing things, and I hope that in future we're going to be able to get the necessary funding to give us the time to do that with each individual. Because I think, especially when you're looking at working with people with quite profound mental health difficulties and possibly comorbidity and things like learning difficulties, etc., maybe brain injuries, then I think it's really important to be able to talk through those issues, to, again, coming up with Helena's work, really managing those expectations. And Helena, do you want to pick up on that and say a bit more there?
Sorry, what would you like me to elaborate on? Sorry, I think that was like a
we're
glitch
talking
in
a
my
bit about going through the expectations with individuals on a one-to-one basis at the beginning of a project.
Yes.
And it struck me that you might have some more input on that.
We have a lot of lessons learned. Whilst we try to manage the expectations for the whole group, we also had issues with perceived favoritism when it came to these one-to-ones. There seemed to be a lot, more so with the UK group rather than other nationalities. I think there's a cultural difference that is for another day to talk about. But the one-to-one concept can easily be perceived as favoritism rather than staff being accommodating to the needs and preferences of certain participants. So I would be careful with one-to-ones in trying to manage those in trying to manage people's expectation of what staff are trying to do by having these one-to-ones. It's not that, we prefer, I don't know, Laura. It's that we're trying to explain Laura to Laura in a language she is comfortable with, the same messaging. So that's just one thing that is quite important to keep in mind. Especially when it comes to a very long project like the one I talked about.
Brilliant, thank you so much. Just one more question, if I may. Oh, sorry, there was one at the back. Sorry, Sophie. Oh, okay.
So someone else wants to go first.
All right, just need to move the mic. I'll be on
Thank you. I was just going to ask, from a training point of view, with the people running the sessions, do you have a robust kind of process for training to enable them to support the participants? So I know at Cornwall Heritage Trust, we have our staff mental health first aid trained and XYZ to make sure that we have that responsibility of caring for people with different mental health needs. And I just wonder if you could speak a bit about preparing staff for running such projects and making sure that their well-being is considered in running these quite complex projects as well.
Mm-hmm. Helena, do you want to address that, or shall I?
I can start and then. So in terms of the staff, it's quite interesting that you talk about the well-being of staff. So there was, we had 2 staff that were themselves disabled and were at the start of the project actually bullied by the participants because they were accused of not having provided all the possible accessibility needs and preferences that should be in place. So I also think that that's something to keep in mind. The staff were not prepared for that scrutiny, and there was not any support by the project actually of it. So these, having learned this, if I ever write or put a project back in this scale with this much funding in place, I would definitely put some well-being time in also for staff to prepare themselves. I think once once we knew the participants better, their weaknesses and strengths, towards the end, we as staff were more comfortable speaking up. But from the start, there was no preparation for that. And I think the fact that the project was in very well-renowned museums, and there was a lot of funding involved, there was an expectations of participants that staff would be, immaculate and in treating them and providing them with everything. And that really had a negative impact. We do have some resources that on ways of working that I'm happy to share with you. They're not specifically on mental health, but they're papers that sort of tickle the subject and how these resources came about. So I'm happy to share those. They're more they were done by participants and staff, so quite collaborative in that sense.
Helena and Will?
Yep. So most of the work that I've done has been in concert with support organisations like local mind groups or Age UK groups. And so the partner organisations have supplied support workers to deal with any crises that emerge. My own background, before I started delivering heritage wellbeing projects, I've been doing mental health support for 5 years at that stage. I've now been doing it, if you include the 5 years I was working at Mola, where I was also a mental health first aider within the organisation, you could put that to 15. But I think it's a rare skill within archaeology. I would, if I were putting together a team for a heritage wellbeing project, I would want the archaeologists to, at the very least, have some awareness of mental health and the situations that can arise and how best to respond to them. I think the mental health first aid course is a very good one. I do think there is one weakness with the mental health first aid course, and that's that it doesn't require you to take a refresher every so often. When I came to work for Mola, I got myself onto another mental health first aid course, having previously done one with Mind Aberystwyth, just to update myself. And indeed, things had changed a little bit in the I think probably about 8 years, no, more than 8 years. It's probably about 10 years since I'd done the original one. So yeah, I'd definitely push for the mental health first aid course to be done, and I think it's worth having partner organisations where you can get them who have that specialist support, that have those specialist support workers on hand to be able to deal with any crises and to advise if anything needs to be tweaked to best meet those needs.
Very good point. Thank you, Will. I think we'll stop here because we're overrun with 5 minutes for your break. But thanks so much to Helena and to Will for a brilliant session. Hope you enjoyed it. Thanks, Helena. I'll say goodbye now, but we'll be in touch later.
Thank you.
Bye. And just to say, okay, this is just to say, if you have booked yourself on the little mini tour for Delapre Abbey, I hope you haven't lost them, but they probably are meeting in front of the main reception area. Other than that, just enjoy the bigger break and lunch later in 30 minutes or thereabouts. Lunch will be served in the salon. And then afterwards, we will continue with the afternoon sessions. Thank you so much.
Why can't we now see it? Okay, that's that fine. That's that one working. So minimize that one, and then we just get it loaded up.
Hi, everyone. We're going to be with you in 2 minutes. Sorry, we're just a little technical hitch. 2 seconds.
Right, hello everybody. I think we're ready to get going. I'm just going to have the door shut. Excellent, thanks Linda. Right, good afternoon everyone. I'm delighted you're all back to join us for the next session where we're going to be looking at evaluation. I think this is a really important area for us to constantly be thinking about and exploring how we do it. I, as part of the Wellbeing and Heritage Working Group, have been leading on the task and finish group that was looking at evaluation and trying to ask ourselves some very simple questions. What are the most effective 3 questions we could ask? How do we get the greatest reach in what we're trying to do? How do we work across some really different scaled projects? So I'll give you one example. The Council of British Archaeology runs the Festival of Archaeology every year. It's a crowdsourced festival, so sometimes we have very small groups and organisations putting on an event. They might be 10 people. Okay, they might do a walk. We can't ask them to fill out 10 questions about health and well-being. So what questions might I ask them? Really important. But then at the other end of the spectrum, and I think we're going to hear about this today, particularly from some of the work that Dicky's going to talk about, we have deep research projects that go into a lot of detail and actually start to look at a great deal of issues around ethics and what the questions are and how we actually structure that. So you've got this huge range of scale that we actually deal with. Yet actually, could we at all at some point bring some of that data together to be able to give a collective response? So evaluation is really important in what we do around health and well-being. And I'm delighted that I'm able to chair this session. And I'm delighted to actually ask Dicky to come to the stage first as our first presenter. And he's going to talk to us about a systematic review in heritage well-being interventions. How are we defining well-being and measuring outcomes? Do they correlate? Dicky, thank you.
Thank you very much. First things I'll say is management of expectations. Keep them low, okay? I'm not going to give you the answer to this. It's work in progress. I'm going to tell you about some of the stuff we're doing, but then you'll have to come back next year to get the actual final input on this. So a quick background about what I'm doing. I still do help Richard Osgood with the Operation Nightingale project. I've been helping the Op Phoenix projects. I'm working potentially with Merseyside Police and looking at developing something for them using a similar model to what we've done there. And I got into this as a participant initially. And so I'm out of my comfort zone a bit now because I'm talking about this academic thing. So I'm doing a PhD, which is bizarre. And as I'm going through this research, I'm unpicking things that I thought I knew, and it's becoming apparent that I really didn't. I've published in this quite a bit, and I'm looking at my own work going, I can't believe I published that, and I didn't put that in there, I didn't do that. So it's been a huge learning curve. So what I want to do at the minute is just give you some examples of what I've done and some of the things that would probably help you guys in when you're writing your reports or when you're looking at developing a project. So a bit of background and context. There's been a huge amount of work, incredible work done across the heritage and wellbeing sector. You've got the stuff done initially by Kiddy and Schofield, so Rachel Kiddy, looking at homeless populations in the cities. How can the built archaeology help that community? You've got the Human Henge project, looking at ancient monuments and how that can engage with people with mental health issues. You can move across and you look at the stuff that Karen's doing with her test pitting, looking at doing the randomized control trials abroad. Or you can go across again and look at Bowman, I think her name is, through combat stress. And they're looking at how you can engage veterans in a museum context, looking at military artifacts to stimulate the conversations, to drop them barriers for engagement. So as a therapy, you go in and you've got some really challenging conditions to get you talking. So some of the things we're looking at, some of the things I've been coming across when I'm looking at the heritage interventions is there's a few themes. So we've got locations, we've got activities, we've got the demographics, and we've got the wellbeing measures. We've talked a lot about the measures today. And when we're looking at evaluating, it's very difficult to look at how we can evaluate a project that uses one of each of these for the same objective. So if we're looking at promoting wellbeing, how can we evaluate a museum-based project that's looking at artifact handling to promote well-being to an older audience, potentially with dementia, and they're measuring it with positive and negative effect scales. How do we compare that then with Human Henge working on ancient monuments outside and evaluating doing a different methodology with a different group? The problem we've got is we've got this huge amount of evidence at the minute, and it's very difficult to bring it together and compare and contrast. So the issues that I'm kind of particularly interested in my research is what are the issues with this research? So like I've said there, how do we compare, how do we assess, how do we contrast these different research projects? How can we ensure that we're measuring projects effectively? There's been lots of talk about how different projects have evaluated scale, have evaluated what they're doing. And they've taken this scale here, but it doesn't quite fit their purpose. So they've taken that bit out, and they've taken that bit out and put that bit in, and then they've used it there. But actually, that scale's been developed through a rigorous method to get to understand that. So if you're looking at anxiety, that scale has been rigorously tested to make sure that that is testing anxiety. If you take out 3 components and add 2, you're not necessarily measuring anxiety no more, you're measuring something else. So that robustness of evidence starts to erode. I'm not saying you're not going to get some valuable information, but then to claim that you're measuring anxiety when actually 2 of the questions confirm that's what you're measuring, and there are they, then you're on shaky ground. Then the big one, what do we mean when we say well-being? We've got 3 different spellings of it. I mean, so if we can't agree on how to spell it, how can we demonstrate it? I thought I knew the answer to this. So we look at the different dimensions of well-being. So this is what works well-being. We've seen these a few times over the past 2 days. When we talk about well-being, initially for me, it was, it's making people feel better. So I'm working with veterans, I'm trying to make them feel better. What do I mean by feel better? Well, psychologically, they're feeling a bit better. They've reduced anxiety, reduced depression, feeling better about themselves. Okay, that's great, okay? Will's projects, the Thames Foreshore Recovery, their definition of well-being might be very different to what my definition is. When you're looking at working with older people, it might be more about the health, the physical health, the reduction of social isolation. Working with homeless populations, their well-being might be, have they got somewhere to stay on at night? I mean, do they feel secure? Have they got a financial, can you develop financial stability? So actually unpicking what we mean by well-being is crucial. And going back to the first point I made, if you're delivering these projects to all these different communities, if you've not defined what we mean by well-being, how can we be sure that we're measuring it and we're measuring the proper impact of it? So if I'm measuring anxiety, if I'm using Warwick Edinburgh and looking for general well-being, if I'm looking at somebody with personal finance issues, so I'm looking at that financial resilience, is Warwick Edinburgh the correct tool to use for that? I don't know. If we're looking at more of a health or personal well-being, then there are probably tools out there that can do that better, but it's understanding what tools we can use and what measures are more effective for this. And most of the people in this room, if not all of you, are heritage professionals, archaeologists. You are bloody good at what you do, but this is a different sphere. This is the social sciences, this is psychology. And I think we have to accept now that this is very much, it's not it's a multidisciplinary subject now to actually do this properly. So what is a systematic review? I had no idea before I started doing this. So in layman's term, a systematic review is a study that is done by the medical profession or the psychological profession to evidence the impact of an intervention. So it could be a drugs trial, it could be a therapeutic intervention. It's doing a very robust study of the literature that's out there in a way that's non-biased. It's theoretically replicable. And then the end output is that the clinicians can use this then to inform their decisions. So when we've talked about social prescribing, this is the sort of evidence that will actually give us that buy-in to them. So it's going to the health professionals and saying, there's your data, it holds weight within your industry. This is our kind of first foot on that run. It's like a science experiment. I mean, your data should be, somebody else should be able to run with this and then come up with pretty much the same results. It's not a literature review. The difference between the two is the systematic review systematically reviews all of the literature with a sense of understanding it and bringing it all together with a narrative. A literature review is looking at this, assessing the data what's out there and probably synthesizing it a little bit. So it is different. So in order to do a systematic review, you have to develop a research question. I know I'm teaching you to suck eggs here, so bear with me a little bit because this is very much in the psychological discipline now, and I'm still getting my head around it a little bit. So what you do is we use there's a format called PICO, population problem, intervention, outcome, comparison and outcome. And for me, when I was developing my research question to look at the database searches, I wanted to look at definitions of well-being. So I wanted to understand what we meant by well-being and heritage. What are our definitions of well-being? The type of heritage engagement, the comparator didn't really fit with this, so that was taken out for this particular study. And then the outcome, what were we defining as outcomes? For me, this was very much an inclusive study. So in order for projects to be selected for this particular systematic review, it had to have been, a project had to have been developed to promote well-being. And when I mean promote well-being, it had to have an active heritage element. So it's not, you can't just come here and do yoga in the garden, make use of this amazing ground. You had to have some tangible link to what the heritage was. It had to, sorry, just jumped ahead there. So it had to have been promoted to develop well-being. There must be a well-being context in it. It had to be a physical heritage intervention, so tangible heritage interaction. And it had to have some method of capturing the change, some method of evidencing the impact of it. And the exclusion criteria, it really was, had to engage in it, and it had to be English language, because I don't have the capacity to Google Translate all these papers and get the nuances lost in translation. What that then does is it creates a huge problem for us. So in order to do this search, I had to then be able to translate that into a system where the database would do my search for me. So I had to include an aspect of each of this. So when I'm asking the database for a search, I'll have 3 search strings using Boolean search phrases. So what I would be, the first question would be, I'd have to put this in here. So the first aspect I'm looking for a paper that's got my problem in there. So something to do with well-being. And it's about using all the phrases that somebody could use in that paper to capture. Intervention, it's about explaining what I mean by an intervention and then the outcome. I mean, what am I looking for in this? And this is very much a loaded, this was very much a loaded task. When I was looking at putting this together, it was very much trial by error. When I just put in one of these search phrases, so if I just looked at well-being, or if I looked at the search strand here, it would come back with 1,082,857 papers just based on them phrases there. Same for this one. If I just looked at them phrases, it came up with that much. And if I just looked at that phrase there, it would come up with 4.2 million. Okay, by using all 3 search data together, so the papers I'm looking for now, it has to include one of them words, and one of them words in the abstract of the title. So again, I'm taking this huge amount of data and these numbers, I'm really condensing them. And by using them 3 search phrases there, I'm ending up with 156 papers that are relevant to me. Now, if I looked at intervention here, and if I use the word historical, that returned back with 116,000 papers, just because of that one word. Okay, historical in a medical, so I'm searching out a medical database here. Historical symptoms, historical causes, family history, all that sort of stuff. If I looked at the words in this one here, if I actually said outcome, it came back with 9,720,722 papers, because outcome is it's a very loaded term. It's used very much in medicine. And if I'd put survey in there, again, it was 9 million papers in return. So it's about doing a lot of testing and adjusting to make sure that the phrases I'm using are going to be fit for what I need, but I'm not going to lose out, or I'm not going to get erroneous stuff. Because I couldn't have gone through 25,000 papers. I'd still be doing it, do you know what I mean, in a year or two's time. So it's very much about thinking about what I want and how to do it. So I ended up with 156 papers, and that's kind of the breakdown. So then by the time I've gone through the screening, so I had to end up with 156 papers. I was just in that one particular search. So after searching all these databases, I came back with 1,140 papers, of which I excluded, and then I added an additional 20 through different search methods. I was able to exclude some just doing a title search, then an abstract search, and I'm left now with 38 papers. So out of that 1,140, I've now got 38 papers that are giving me all them 3 search terms for this review. So it has really brought that data down. And that's because I've been able to frame the question properly and understand what it is I want. The next phase is, again, so just keeping that bias out. So like I said, I've been very inclusive in this data. It really has been, it has to literally exclude itself because it doesn't meet it. The next method of removing the bias is by using critical appraisal skills programs, so CASP. So using things like Prospero, you can download these tools and it will help you extract the information that you want from your study in a way that is going to reduce the bias. So you've got a standard way of doing it. And at the end of it, I should be left with a set of data that's as least biased as possible, that's ready for use. And then that will be produced in a narrative synthesis. So that is, when I've got this data, I'll be producing it in a way that is going to be explanatory as opposed to texts, as opposed to tables and charts and everything else. The whole point of this is to understand that narrative. What do we mean by well-being? What is, of these 38 included studies, what do they mean by well-being? How have they broken that down? And how has that been put back together then? What evaluation tools are you using? Okay, and what is it they're actually measuring? So hopefully by the end of this, we'll have a synthesis of all the projects that are out there at the minute to really start evidencing what we're doing. While I've been here over the past 2 days, there's been loads of talks with papers that haven't been published yet. So already as I'm doing this is already getting dated. because there's a lot of stuff going on that's probably not going to be included in this. So all I'll say is if you've got some papers, or if you're doing a study and it's in that stage where you've got some form of report, and if you want it to be included, please let me know, and I can see if we can fit it into this. So the next steps for this, I don't know. I'll be doing a systematic review. When this is done, that will inform the next steps of the PhD. So ultimately, we'll be looking at, we identified what we mean by wellbeing. It's talking to the stakeholders now and saying, look, you're delivering these wellbeing projects. What is it that you want to deliver and how are you doing it? And having a discussion about how we can not standardize a evaluation methodology, because like I said, we're all human, all these projects are different, so there will be the nuances, but it's how can we start bringing the evidence together so that when we are looking at comparing human henge 0.2 with Carenza's projects in the future, we can start looking at the comparables between them. What aspect of that works, and how can we then link that to what aspect of that's worked and bring it together and then build on that data. And again, for me, the key point of this, it's making this study accessible. It's not going to, as much as it can be, I don't want it to be in academic jargon. I don't want it to be, it's got to be in layman's. This has got to be able to be used by that local project that's trying to develop something down the road, and it's got to be meaningful and useful for them. And then this has been done in collaboration with Karen Bennell, who did the Amphora guidelines, is my supervisor. And because I don't do maths, I've managed to get a really great bloke called Craig Allison, who is a psychological statistician. It's always good to know one of them. So anyway, if you've got any papers that you might want including, please let me know. I'd be happy to do it. And hopefully that's just give you a bit of an understanding of when you are doing your reports and when you are writing things up, the sort of things that you need to really start thinking about to make this a more inclusive sphere, I think. Thank you very much.
Brilliant. Thank you, Dickie. We're going to do questions at the end. I'll get all our speakers back up on the stage. But what I'd like to do is move straight forward now and ask Liz Goodwin and Shannon Horgan to come to the stage. So Liz is from the University of Exeter and Shannon is from the National Trust, and they're going to talk to us about evidencing the value and the value for money of heritage-based interventions. Thank you.
Right, hi everyone. I'm Liz Goodwin and I'm from the University of Exeter, and I'm a health economist, or as somebody referred to me as yesterday, cost-benefit woman, which has got to be the most rubbish superhero ever. A health economist is basically someone who applies economic principles and methods to the study of health and healthcare, and what's probably of most relevance for today is one of the things we do is provide evidence about the value and value for money of healthcare interventions. And recently, my colleague Annie Horton and I have been applying some of these techniques to heritage-based interventions. So today we're going to be talking to you about some work that Annie and I are doing or have done with Shannon here, who is from the National Trust, and also with Vanessa Heaslip from the University of Salford. So I'm going to be using the term heritage-based interventions today, so I thought I should probably provide a definition, which I've done on the slides there. And as the images on the slide suggest, there's quite a range of different types of heritage activities that can contribute to people's well-being. And I also think that there's a bit of a spectrum here. So at one extreme, you've got interventions that are designed explicitly to improve people's health and well-being, and they use heritage as a means of doing that. So with those, the focus is on intervention. And then at the other extreme, you've got the kind of heritage-based activities that people just do as a hobby, a personal interest. So there, the focus is very much on the heritage. So these are not things that are designed at all as interventions, but they do still have a positive effect on people's well-being and on their health. And I'm going to be giving examples from kind of opposite ends of that spectrum today. Now, I would imagine that everybody in this room believes, or dare I say knows, that engaging in heritage is good for people's health and well-being. But so far, quite a lot of heritage and wellbeing projects have been time limited and relatively small scale. So what I'm interested in is, how do we step this up? How do we make sure that more people have the opportunity to benefit from these kind of interventions? Who do we need to convince of these benefits? And what evidence do we need to persuade them? So one very obvious option is to go through social prescribing. Social prescribing, of course, is an NHS initiative. So the people that we need to persuade are NHS decision makers. And NHS decision makers do expect quite specific types of evidence. They expect to see clinical trials and economic evaluations to show the value and the value for money of interventions. And work has already started on applying these kind of methods within a heritage context. So Corenza Lewis and Joe so far, among others. And today I'm going to be talking to you about some of the work that we've been doing in this area. But before that, I'm just going to run through some basics, because even if we're not going to go down the route of kind of full clinical trials for heritage-based interventions, it is worth understanding what the key components are, and how perhaps we might adapt these to kind of fit with the heritage context. So, what is a clinical trial? A clinical trial is used to show whether a new treatment works better than the usual treatment that people currently receive. So it compares the effects of the new treatment with the effects of the kind of existing usual treatment. And we do this by recruiting a number of participants, so that's people with the health condition that the new treatment aims to treat, and we split them randomly into two groups. We measure the health of the people in each group at the start, and then one group gets the new treatment, while the other group, the control group, gets the usual treatment. Then, after they've received their treatment, we measure the health of people in each of the groups to see how much their health has improved. And if the group who gets the new treatment has a bigger improvement in their health than the group who got the current treatment, then that shows that the new treatment is better. With an economic evaluation, you need to collect some more information during the trial and do some extra analysis. So with an economic evaluation, at the start of the trial, we measure what healthcare services people have used in the few weeks prior to starting the trial. And we also measure their health using a slightly different method to what you need for the trial itself. We also measure how much it costs to provide the new treatment and how much it costs to provide the usual treatment. And then at the end, we measure what other healthcare services people in each group used during the trial. And so this is something that's been mentioned in a couple of the earlier presentations. The idea being that if a new treatment works really well, it might mean that people don't need as many GP appointments or hospital visits or drugs or whatever it might be. And then analysing all of this data enables us to work out if the new treatment is good value for money compared to the existing treatment. So what happens if we replace the medical intervention with a social prescribing intervention that's based on heritage? Well, I think there are likely to be some challenges. And that's largely because the methods that are used in clinical trials are designed specifically for kind of standard healthcare stuff. So drugs, surgical procedures, that kind of thing. And the ways in which heritage-based interventions are run and provided are very different. Plus, they're not exactly healthcare interventions, so we might want to measure slightly different or additional things. So we might be interested in the impact on people's general well-being rather than just very specifically on their health. And we might be interested in a wider range of different kinds of service rather than just healthcare services. So that was the background. What I'd like to do now is just focus on a couple of specific projects, one past and one current, and then open things up a little bit to think a bit about the future. I'm going to start with the Scaling Up Human Henge project, which we worked on with Vanessa Heaslip and a range of partners. I'm going to read these out. So this was Bournemouth University, the Restoration Trust, Avon and Wiltshire NHS Mental Health Trust, English Heritage, Rethink Mental Illness, the Richmond Fellowship and Wiltshire Museum. So the main research question for Scaling Up Human Henge is how best can we deliver viable and sustainable place-based cultural heritage therapy programs using archaeological sites and ancient landscapes to benefit the health of whole communities. And a key objective of this study was to evaluate the therapy program. And so that's where Annie and I came in. So this was a very actively therapeutic intervention. It aims to harness the power of place, and it used group activities involving archaeology, music, dance, and craft-based activities. The group met once a week for 10 weeks, and it was a group of 18 people with quite serious long-term mental health conditions, and there was no control group for this study. For the evaluation, the idea was to collect the kind of data that we normally would for an economic evaluation. So we asked people what health services they used, plus any social care or voluntary sector support. We asked them about their health, specifically their health-related quality of life, and we used the measure that is like the standard measure for economic evaluations called the EQ5D. As well as that, we asked them about their mental well-being using the SWEM Webs, the Warwick Edinburgh Wellbeing measure that others have used. And we collected this data before, during, and immediately after the programme, and then again 6 months later. And we did all of this alongside a qualitative investigation that was led by Vanessa. And we got two different types of output from this. So one thing was to get the actual results of the study. So what were the effects on people's health and well-being and resource use? And the other was for us to learn about collecting economic evaluation data in the context of a heritage-based intervention. So in terms of the results, with service use, receiving the Human Henge programme didn't really affect the type or the amount of services that people used over that 6 months period. So this might be indicative of the significant mental health support needs of this group. And also it could be related to the fact that Human Henge isn't really a healthcare intervention itself. So maybe we wouldn't expect it to kind of replace the healthcare that people receive. In terms of people's health and well-being, at the start of the programme, people's health-related quality of life was strikingly poor. But both their health-related quality of life and their well-being had meaningfully improved. You can see on the graph here, the third one along is the end of the programme, and you can see that both health-related quality of life and well-being had improved by the end of the programme. However, if you look at the fourth columns there, after 6 months, people's well-being and health-related quality of life had dropped a bit. So I'll say a bit more about that in a minute. There's an important caveat here. We do need to be careful about reading too much into these results because it was a very small sample and there was no control group. So what did we learn about collecting the economic evaluation data in this context? I suppose the main thing is, yay, it is possible to collect this data in a heritage context. There's a point I think comes up around sort of funding and support infrastructure. I mean, for this evaluation, we were a bit limited in what we could do. Usually in health research, I mean, there's like a massive national and local infrastructures around health research, specifically around sort of trials and economic evaluations, but more generally as well. So if we want to do this kind of research in a heritage context, we're either going to have to tap in to those existing funding and support structures, or we're going to need to develop our own. And we also felt that there's room for some longer term research here as well in a number of areas, but specifically we really want to understand more about that reduction in health and well-being after 6 months. What happens after that point? Does it stabilize at that level? Does it continue to drop? And would a kind of maintenance dose of the intervention help to generate more kind of sustained improvements over time? So that's that one. The project is finished. We're currently writing it up, and we will be submitting it for publication in a peer-reviewed journal at some point soon. And Dickie, we will be in touch because we'd love it to go into your review. I'm going to move on now to some stuff that we're doing currently. I mean, very currently. This project started just this month. This is one that Annie and I are working on with the National Trust, specifically with Shannon and also with Tom Dummett. And so before I get stuck into this project, I'm going to hand over to Shannon to talk a bit about the National Trust and wellbeing in general.
Thank you. Excuse me. So National Trust is a bit of a random 2-minute interjection because it's mostly Liz that you're here to hear from. We like pretty pictures of people enjoying themselves and looking very happy. That's often what you see with the National Trust. But why am I here? So I'm the National Archaeologist, which sounds like a very grand title. It really just means that I support anything around engagement with archaeology / historic environment / heritage, which unfortunately we use slightly interchangeably in the National Trust. But my background is very much a field archaeologist from East Anglia. The wellbeing area and evaluation, I sort of fell into it partly through this working group that you've heard us all reference many, many times, and partly because I was given the remit when I started in this post a few years ago to evaluate the benefits of participating in archaeology. Then I went into this working group, and I must admit I panicked massively because you think that sounds quite simple, right? We evaluate the benefits of archaeology work, but then you start thinking we're talking about historic environment as well. We're talking about all things heritage. And actually this group opened my eyes to the fact that it is much bigger. And as Dickie said, it's not just well-being, but actually heritage, evaluation, heritage generally is quite a big thing to tackle. So I thought about what we're going to evaluate, what and how. And then I thought, well, we'll evaluate what we do. And I thought, what do we do in the trust, actually? And I panicked. I thought, we're behind the sector, actually. We're behind. We haven't thought about this sort of consistent approach with how we evaluate things that we're doing. But I realized that's not actually true. We do stuff in the National Trust. We do stuff everywhere. We do it all the time. I've seen oak leaves in people's various presentations. A lot of the projects that people have referenced here, they've been partly on National Trust land as well. We are involved. We've got work going on with Exeter, UCL, Southampton, CBA, and others. We are doing stuff. The Heritage Open Days team, who some of you might have heard from this morning, they're very much starting to lead that way in sort of heritage and evaluation for an aspect of the National Trust. So we are doing things, but the caveat is that the National Trust tend to focus on articulating those benefits associated with nature engagement. They've started to move into that sort of curated space into our sort of houses and our sort of, our grand houses and buildings. But what about that intangible or that less tangible cultural heritage and the impacts on well-being that those outdoor cultural heritage landscapes might have on people? So the challenge for us is huge because we've got around 500-ish properties, 250,000 hectares of land, each with their own property team, each delivering their own initiatives, each doing their own thing, working with different communities, different people, different aspects of well-being, different populations. It's a very, very complex thing. So how can we think about a consistent approach to understanding and measuring the well-being impacts from heritage specifically, and heritage at our places, our diverse range of places? And as Dickie said about well-being being so broad, and talking to the HODS team, heritage is broad as well. These are two massive concepts that we're trying to pull some sort of national consistency towards. So I feel relieved in the fact that I've not achieved that yet. I haven't come up with a framework in the National Trust, and that's okay, because as a sector, we haven't got a framework for it. So that's okay. So for me, I think the answer for the National Trust right now is partnerships and it's research. And this is the area that I'm really, really excited about, because I think we've got two things that we can look at in the National Trust. We can understand those day-to-day benefits of people experiencing our sites and our landscapes, and we can try and pull out that specific connection between the cultural heritage and well-being in landscapes that are often perceived as natural. So we can start to move away from just looking at the well-being effects of nature engagement and start to look at the sort of cultural heritage aspects of the well-being impacts. And the other thing that we can do is we can offer spaces and places to test and to research heritage-based interventions as well. So we can generate that evidence, we can generate those learnings for the sector, but also that can help our individual properties drive and deliver wellbeing through heritage engagement and all the different types. So I'm really excited that I think we're at this really pivotal point in the heritage sector about driving research in different directions. And I'm really excited that I get to work with lots of different people in different areas of wellbeing research. And specifically the project that we're doing today, which is looking, I never would have dreamed that I'd be working with health economics, but obviously I'm moving into this direction temporarily, and another day I'll be in a different direction. So I'll hand back to Liz to talk about the project that we're doing.
Thanks, Shannon. Right, so the project that we're doing is called Conserving the Mind. And the research question here is, does conservation in action produce a measurable impact on the mental well-being of visitors? So conservation in action, I'm hoping I'm summing this up correctly. It provides opportunities for visitors to observe conservation work at various National Trust places, and they can speak to the team who's doing it and find out about what they're doing and why. That make sense? Good, thank you. The reasons why we're doing this, we want to try and develop an approach for generating evidence for well-being impacts right at the point of engagement. We want to produce evidence to inform National Trust planning for future activities. And also this is seed funding. So the big idea here is that this is an initial step, hopefully, to developing future research funding applications. We're currently in discussion with 5 National Trust properties that will be running conservation in action activities. So these are activities that would have been happening anyway. So this is not an intentionally therapeutic intervention. We'll have a larger sample than we had for scaling up Human Henge. So we're aiming for around about 300 participants overall. And they will be members of the general population rather than people with a particular health condition. And this will be adults rather than children, but this photograph was too good to not use. We will have a control group this time around. These will be people who are visiting the same places but not participating in conservation in action. But we'll be looking at the immediate effects only. So we're going to ask people to complete a wellbeing questionnaire immediately before and after their visit, but we're not going to be following them up longer term. And we're only looking at well-being. We're not looking at health-related quality of life or service use. And similarly to scaling up Human Henge, there are 2 sort of things that we're hoping to learn out of this. One is we will obviously analyse the wellbeing data that we get to see if there's a meaningful change in wellbeing from before compared to after the visits, and whether that's different in between the visitors who have and have not engaged with conservation in action. And then there's what we expect to learn. This is the bit I'm calling the feasibility analysis. So is this something that we can practically do? So there's some statsy kind of stuff that we'll do there. So we'll look at things like response rates and missing data and statistical distributions of responses and things. But also it'll be really useful to get feedback from the sites on what it was like to actually get the data. So look into the future. So far we've applied kind of bits of the methodological framework for trials and economic evaluations, as have others as well. So where do we go from here? It seems to me that there are 2 options, and there are certainly two views that have been expressed over the couple of days here. And these 2 options are not mutually exclusive. So one is we put all of those pieces together and we go for it and we do a full RCT, randomised controlled trial of a heritage-based intervention. And we are taking this forward, hopefully, because we've got a current funding application in that's led by Carenza Lewis. It's called Heripart. So fingers crossed we get the funding for that. The second option is to take this methodological framework and adapt it into something that is practical and achievable within the heritage context, that will be generalizable across different contexts within heritage, because I know that was a concern expressed last night about whether clinical trials tend to be a bit too narrow in their focus and lack that sort of generalizability. I think that is something that we can address. And finally, it will have to be capable of producing the evidence that we need in order to convince the key decision makers. And so really, this is why I'm here, is to have those discussions about where we go from here and what role health economics can play in building the evidence base for heritage and well-being. Thank you.
Thank you very much. Right, I just got to quickly change screens. Just want to check, can everyone see that? Is that working online? Great. Brilliant. Right, and now for our last speaker. I'd like to welcome Chiara Amini from University College London to come and talk to us about understanding the socio-economic well-being benefit of engagement with heritage, action and creativity, a UCL, South Downs National Park Authority and Seaford Town Council knowledge exchange project.
Hi everyone, I'm Chiara Mini and I'm working on this project with Sarah and John, who are not here. So first of all, Sarah and John are the archaeologists. I am the social scientist stroke economist here, so a bit more in line with the previous presentation. So this is very much a work in progress. At the time when we applied for the conference, we were hoping to have some result from some preliminary data collection, which is mainly qualitative. Unfortunately, the project is on hold, and I'll explain why. So I don't have any evidence to show you or to present, but rather I'm going to talk through the plan of what we are doing and further fundings that we have secured and how this integrates with other projects. So it will be useful to have some discussion on what our aims and objectives are, our methodology, and how to overcome some of the challenges. So it is a fully interdisciplinary project, as I'm the social scientist in the team, and we are working with the archaeologists. So we are aiming to really co-create a vision with a target group, which in this case is young people. We started with the target age of 16 to 24, but we actually working with slightly younger group at the moment, which is 12 to 16. And mainly we're targeting young people living in Seaford, which is on the coast in Sussex, that are facing social, economic, and other barriers to opportunity. And we are interested in understanding how our target group view local heritage, and heritage in this sense, it is cultural heritage, archaeological heritage, but also nature, and because we are looking at a specific site that includes all these elements. And by looking at the interplay and interaction with heritage, we want to explore the link between education inequality, employability, and evaluate the benefits, the potential benefits or consequences of interacting with the local heritage. And we are looking at well-being, just linking to the first presentation, what do we mean by well-being here? We look at psychological well-being, and we have a plan for how to evaluate it in a way that has been done before in other projects, but very much in line with what was mentioned in the previous presentation. But we are also particularly interested in employability and future educational opportunity in heritage and potentially in the creative sectors, and I'll tell why. So just a bit of background of where we are working, what is our site. So we are working on Seaford Head, which is a bit of a cliff on Sussex. This is a nationally important area featuring archaeology of multiple periods. So don't ask me any question about the archaeology bits because my colleague archaeologists are not here. But it is a beautiful cliff, which you can see here. Maybe many of you have seen it. It is white cliff that are very, very impressive. There is a path going along the cliff, which is at risk due to climate change. And the current path, which goes through a golf course, currently has to be rerouted. And this is due to cliff erosion. And hence our project is particularly meaningful because we are really looking at a site that has a cultural, natural value in the context also of climate change. And we are really interested also in understanding the extent to which our target group is aware of all these elements and how they perceive these aspects of heritage, which is something that maybe sometimes it is overlooked. So this is where we are working, and you see how as various sites in Sussex, and my colleague archaeologists are engaged with that. So, but we know that awareness and use of coastal heritage is low. We've been working with the local council, with charities, and the South Down National Park. So these are our 3 partners. And we know from the local council that there is an issue with engagements and awareness of the local asset. And hence, we want to understand more of why and how people engage with specific sites and the consequences of it. So there is an input and output aspect of it. Just from a social science point of view, that's sort of my interest here and my role in the projects. We're looking at the benefits or potential benefits of cultural and natural heritage because of well-being, and all of you are aware of this, so I'm not going to go over this. But also the benefit in terms of providing employability, transferable skills, opening up for opportunity in tourism, creative industries, and maybe foster entrepreneurship. So we know that there are a lot of potential benefits by engaging with heritage, both cultural as well as natural, that can then transfer to aspects of life behind psychological well-being. And this is also what we are particularly interested, because this might be very relevant for those that are shaped and affected by socioeconomic inequality. And for this particular target group, what it is important is also how heritage it is perceived and how it is valued, which from an academic point of view, I believe it is something we know a bit less about it. So how do we want to explore these issues and evaluate our intervention? So we have multiple methodologies that we are planning to use, and I'll tell you why the project is on hold in a minute. So our ethos is really to use co-produce research with the different stakeholders, which has the council, South Down National Park, youth groups, and the target group itself, to have a better understanding of what the key priorities are, what insight can we gain, and what can be done. We also plan to use specific creative tools and art-based methodologies to facilitate discussion and engagements of our group. For what concerns the well-being part, what we were planned to do, it is to use the UCL well-being umbrellas rather than the Edinburgh scale, because my experience in other projects has been more in favor of using the UCL well-being umbrellas rather than Edinburgh scale. And this is, hence that's what we were planning to do, to use the UCL framework to have an understanding of well-being in one point in time, so before a specific event, during the event, and after. So keep in mind that this is a small project. We have, at the moment, we have about 20 participants, and we are going to run 3 events with these participants. The events that we are planning to run are quite structured, in the sense that the first event includes photo elicitation. So we get the young kids to go and take pictures of what they think is their local heritage, and we use the visual element as a starting point for discussion. Then in the second event, we were planning to take them to the cliff to have a walk and talk session with a talk by archaeologists, and maybe some also potential to actually do something. That's not my part. And the well-being evaluation with the UCL scheme before and after. And then we were going to do another workshop with the same group, using the visual output from the 2 previous events to better explore how they perceive the place and the potential outcomes of this interaction, maybe in terms of opportunities, future opportunities. So now we have not done this workshop yet because unfortunately everything was planned around the cliff, which is this important site, because recently, unfortunately, there's been a suicide episode of a young person from that cliff. So the council and the youth group and the school that was partnering with us, were not feeling comfortable in running an activity or a series of activities that were so focused on a specific site. So they're still keen to work with us, but so we have slightly rerouted the projects to around local heritage and the South Down National Park without focusing so much on the cliff. The cliff was of particular interest to us because of its heritage, and locally people feel very, close to this space. There are also some cottages that are widely debated at the risk of disappearing under the sea. Am I running out of time? I'm not keeping time. Yeah. So anyway, we are rerouting the project to make it relevant to the local space and heritage, not just so focused on the cliff. We have obtained further funding to link this project to something else that we are doing in Brighton. But yeah, this is, so I think I'm sort of running out of time. This is the youth needs in Seaford. We know, that from talking to the council, the young people face some challenges, and hence this is why we want to work with this particular group. But in terms of evaluation, so much. We were going to evaluate well-being using the UCL framework with a sort of before and after follow-up, keeping in mind that this is a very one point in time intervention. But at the broader level, we are interested just not in well-being, but also in other aspects related to opportunity, employment, and how people interact with a space. Yes, so that's it. And so,
We're going to have a couple of questions. Sorry, Chiara, could I ask you to come back to the stage? Oh, yes. Dickie, could you come up? And Liz and Sharon, could you come up as well? Just run around with the microphone. So we've got a couple of minutes for questions. Anybody got a question? Yes.
Thank you very much, everyone. It's a brilliant range of talks and some really useful ideas about how to start kind of measuring things. My question is for people who are kind of setting up trials and projects that seek to measure the interventions, and whether you get a sense that there are some key differences in measuring wellbeing projects on the basis that sometimes activities that try to measure people's well-being might actually be detrimental to their well-being.
Yeah, I'm happy to say something. So from my experience of running another project where, again, we use the UCL framework, I don't want to advocate it because I'm from UCL, that it is useful because we ask people about positive and negative emotion. And so in one particular intervention that we looked, or was not intervention, program, people also highlighted some potential negative aspects. And it is true, you also need to take into account these elements. And this is important for us, now with the what has happened around the cliff, we're not really sure what to do, and yeah.
I just wanted to follow up and say that we use the UCL umbrellas as well, and we found them quite helpful because it didn't clinicalize a lot of things. So we have a lot of disabled people and a lot of people. Yeah. Okay.
Yeah. I just wanted to say that we use the UCL Wellbeing umbrellas as well because we didn't want to use the Edinburgh system because that clinicalized everything too much for our participants who are coming to us trying to get away from a lot of those things. So the wellbeing umbrellas were very, very useful in that particular regard.
Okay.
I think ultimately, Dickie, could I ask?
I think the bottom line is what do you want that data for? And I think you have to be very conscious of why you're collating that data. If you're collating data for data's sake, then do you need to? If you're measuring, if you're working with vulnerable people, and getting them to fill in a survey might be a barrier to them engaging with what you're doing, I think that's a conscious point. And what you ask them at the end point might just be a conversation, just that informal interview almost. How are you getting on? What did you do? What did you like? What didn't you like? That might be the best approach. So I really think it is just why you draw on the data. Did I answer the question?
I'll just jump in really quickly. Because everyone's been going around different things, but anyone who was around this morning, there was a workshop on the sort of toolkit and a workshop talking about sort of evaluation. And you're right, that asking certain questions can be detrimental. So it's about not establishing toolkits necessarily or things that are set in stone. And yes, there are like standard measures which can be used, but you've got to question whether those are really applicable. And the other thing I'd like to add on that is be open to, so certainly for the trust, we're dealing with, in the cliff example, but we're dealing with heritage loss at a massive scale, and we're trying to bring 6 million people on board with that journey and that story and what we're choosing to save and preserve and how heritage fits in with all of that. And the meaning and value to people. What you have to understand is the more you introduce to people, the more you talk about it, actually that can have a really negative impact on their well-being, because when you ask people, how do you feel about loss of heritage and climate change? And they might know a certain amount. When you educate them and you say, this is going to happen in your lifetime, their well-being might come down massively. So it's about using the tools that are most applicable at the time. But I personally think we've got to be careful about setting ourselves in stone around frameworks and having that rigidity, because it just doesn't really work and it's not applicable. And I think you've got to question, as per intervention or activity, what feels right and relevant for that specific group or that specific action, and be open to the negative impacts on wellbeing.
Great, thank you. I'm going to try and find someone else for a question now. Anybody? I've got one here.
Thank you. Question for Liz, please, if that's possible. So separate to heritage, I just wondered if you've done any other research from a health economy point of view about social prescribing, and if that's shareable. It'd be really useful to share with local health systems.
No, sorry, very short answer. We've done sort of various kind of unusual interventions, but they've all been sort of very firmly in the health sphere so far. So Human Henge was the first, hopefully the first of many.
Okay, anybody else got any questions? Don't panic if you haven't. We've run over. All I'm going to say is thank you to the panel, the speakers, really brilliant. I look after the research and evaluation community of practice for the Wellbeing and Heritage Group, so we will definitely continue these conversations there. Just one thing I just want to reflect on in all of this. I really am pleased Dickie highlighted spelling as an issue. I'm dyslexic. I can't tell you how you spell well-being ever. It's like the word pillbox. It really irritates me. But the greatest comment I will ever say to you is, don't panic. Shakespeare couldn't spell anything in his entire life consistently. And apparently he was really good at English. Thank you all very much.
Yeah, we're ready. We're ready.
A few technical issues. We'll start very shortly. In the meantime, I'll do a musical number.
Oh, good.
You're good? Okay. As we're running a bit behind schedule, I will just introduce the section. My name is Peter Ayres. I'll be speaking a bit later on, but this is all about places, worship and wellbeing. We've got 3 presentations, and then we can do a question and answer plenary at the end. So without further ado, I will introduce Eddie, who's going to talk about the National Churches Trust work and wellbeing in church buildings. Thank you, Eddie.
So thanks very much, Peter. I've been here yesterday and today. I'm sort of very, in a sense, humbled by all the individual presentations that people have given and hearing people's lived experience of all the interventions, we're calling them, all the work that's been done by small organisations, medium-sized organisations, trying in a sense to improve well-being, to make everyone happier, to make people feel better. And it's really just the scale of it is really huge. Just here for these last 2 days, so many people have talked about individual things. So I've got a slightly different view of this. I'm looking at it from the other end of the telescope. Rather than looking at an individual intervention, I'm trying to tell you about churches as a sector. And the well-being benefit that churches provide to the UK rather than one individual project. So it's sort of macro rather than micro. And what I'm going to tell you about is a little bit about what is well-being. We've heard everybody's been talking about well-being, but it probably means slightly different things to different people. I'm going to tell you a little bit about the church sector. It's a big sector, lots of buildings, not all of them heritage buildings, but the majority of them heritage buildings. Then I'm going to talk to you about a report that we did a few years ago called The House of Good. And then I'm going to talk to you at the end just about some other little bits of research that we're doing. And I'm Eddie Telesevich. I'm the head of policy and public affairs for the National Churches Trust. We are a UK-wide charity, been going in one form or another about 200 years. We support church buildings. We come from a heritage background, but they don't have to be listed buildings. We support church buildings that are open for worship, any denomination throughout the UK. We're primarily a funder. We give grants for fixing things or putting in loos, basically to keep those buildings open. UK churches and well-being. Well-being. It's why are we interested in well-being as an organisation, or more generally? Well, what we wanted to do was to tell the people who, the Treasury, government, other funders, that church buildings are important and that they've got a real financial contribution to the well-being of this country, the United Kingdom. In a sense, what is the return on investment that government or another funder would have by putting in £1 worth of grant? What are they going to get back for that? What's society going to get back for that? So we're interested in well-being because well-being is sometimes it's the same thing as happiness, or happiness is well-being, or happiness is part of well-being. Yesterday was International Happiness Day, you may have noticed. That's a day that's run by the United Nations. It's a worldwide thing. And there are lots of sort of economists and statisticians and data gatherers who try and work out how happy people are. And it links into sort of the well-being economy, people trying to look at the world in a way that isn't GDP, gross domestic product, which is gross domestic product is just how much money is produced by building things or making things. You can also measure people's well-being, and that's another way of looking at the world, really. Well-being, we think that church buildings have, and as we've heard the last 2 days, all of heritage has got a really important role to play in increasing well-being. And if you're a policymaker, if you're a funder, you may have to, you may think, why do you choose one thing rather than another? Why should the government fund this rather than that? Policy A may have a bigger impact on one objective, maybe getting people into work. Policy B may have another objective. It might make people healthier. There's a guy called Professor Lord Richard Layard, who's at the London School of Economics. He's the sort of well-being guru, and he says that governments should determine where they put their money by the well-being of people. So it's putting well-being at the centre of sort of economic decision-making. If you're interested, there's an organisation, Oxford University, called the Wellbeing Research Centre. Look them up online. They do a lot of research into well-being and the economics of well-being. Oxford University, do look them up, the Wellbeing Research Centre. That's sort of, and just in terms of why it's important, I've got a quote here. There may be a change of government, there may not be, but Keir Starmer recently said, as a quote, "With every pound spent on your behalf," that's the taxpayers, "we would expect the Treasury to weigh not just its effect on national income, but also its effect on well-being." So, it's really important in terms of policy making at a national level. What about well-being economics? Okay, because economics is part of well-being. So we, as an organisation, National Churches Trust, want to build the evidence case for church buildings. It's the same for heritage more broadly. We need to build that evidence case. So why should they be funded? Why should Historic England get any money? Why should the lottery fund heritage? What's the point of it? It really comes down to choosing those policies which might produce the most well-being for every pound spent. Okay, maybe not all the time the greatest amount of well-being from every pound spent, but it's important. If you've got a limited amount of money, you want to put that money where it's going to have the greatest effect. We've heard a lot about health economics. It's been very important for health economics. So sometimes treatments are accepted by the NHS, sometimes they're not. Cancer drugs, expensive treatments. And why? Because they don't have enough long-term well-being effect. A cancer treatment might only keep someone alive for 3 months, and it's really expensive. So instead of putting the money into that, they'll put it into something that might help people for 3 years. So there's more sort of, those people are going to die, but more people are going to live by funding the other thing. And the important body in all sorts of government funding is the Treasury, Jeremy Hunt and the Chancellor, and they have in their funding criteria, which is called the Green Book, the Treasury Green Book, social well-being is one of the goals, and there's a measure that you can measure well-being as a monetary equivalent, which is called, strange enough, it's called a Wellbe. And that measures the sort of well-being benefit, and it's taken partly from health economics, but there is something out there called a Wellbe, and you can measure things by Wellbes. Okay, so that's a brief introduction to well-being, why it's important, and well-being economics. I'm not an economist, so I'm trying to keep this relatively simple so I can understand it. There's a lot more detail to all this, of course. Briefly, churches in the UK. I don't know, how many of you know about the church sector. Okay, there's a bit of a spin here. They're impressive, exciting, and surprising places. There are about 38,500 churches in the UK that are open for worship, not every day, but on a regular basis. And 20,000 of those are listed. So that's heritage. 20,000, over half of all churches are heritage buildings. They could be 1,000 years old. They could be Victorian. They could even be 20th century. They're listed buildings. Those 20,000, nearly half of those are grade 1. So it's really important heritage. So as well as their heritage, they're important for all the community stuff that happens. We've heard a lot about community hubs. A lot of churches are community hubs as well. They do huge amounts of things, from food banks. I've got a whole list of them here. Activities for the elderly, dementia cafes, sports activities, holiday clubs, drug alcohol support, lunch clubs, blah, blah, blah. Lots of things happen in church buildings that are of benefit to the community. They also have a very large number of volunteers. And volunteers, by volunteering, that's a really good way of increasing somebody's well-being, especially if they're doing it in a group of people. They're also used for worship. I suppose we could call churches Heritage Plus. Okay, and of course there are buildings of other faiths as well. that do similar things, mosques, gurdwaras, temples, and so on. Churches aren't the only religious buildings around. But as a lot of heritage, churches are under threat. There's a huge repair bill. Church of England estimates it's got a backlog of £1 billion. In Wales, a quarter of all churches and chapels have closed in Wales. In Scotland, 40% are at risk. And some of that's to do with changing societal trends. Some of it's just simply to do with the fact that there isn't enough money to keep the buildings going. These are expensive buildings to run. If you want to fix a roof on a medieval church, it's going to cost you, £500,000. And if it's a small church in a, rural area, it's very difficult to get the money. And the funding from government and heritage bodies, it's less than it used to be. Churches are under threat. So that's why we wanted to show the well-being value of churches to try and get more money for them. I'm not going to show you a video. You can go to our website and find things to watch there. Very briefly, people still think churches are a good thing. All right, the last census, only 46% of people identified as being Christian. 37% said they had no religion. But our latest opinion poll, which we did in December last year, 68% of adults agree that they're an important part of heritage. Okay, 66% think they're important for society, and more than half of all adults did visit a church building last year, 54%, and 17% went as a tourist or visitor. People do use those buildings. In terms of community use, which is really what I'm talking about, well-being, these are some of the things that people say they do when they visit a church. The top 5 things: they go to a concert or a musical event. A lot of music happens in churches. They've gone to a food bank. They visited a craft fair. They've gone to a nursery. They've been to a warm space. Those are the 5 top communities things that people have done. Okay, so now we're going to get on to the slightly more complicated, or for me anyway, issue of well-being, how you measure it, because we're going to get into some numbers here. It's the community use of church buildings that we looked at to look at their contribution to well-being in a report that we did called The House of Good. If you Google The House of Good with National Churches Trust in the same search term, you'll find it. All the reports are there, all the evidence is there, lots of stuff that I haven't got time to talk about. Basically, we look at the sort of well-being value, what's called the non-market value. Everything has a market value. A church has a market value because it might employ somebody. It pays, to have something fixed. So that's the market value. The non-market value is the well-being that happens because of volunteering, by people taking advantage of, food banks, taking part in some heritage event, even just visiting the heritage. The last paragraph here is the sort of technical one. So our economists converted the market value of well-being into a monetary value, blah, blah, blah. It's accepted by the Treasury. And that is right. When we first did this report, it was valued, each well-being had a value of £2,500, okay? 2,500 quid. And then it's a question of multiplying. Not everything that you do in a church has a well-being value of £2,500. It could be slightly less, it could be slightly more, and then you multiply it. So if you've got 100 people, let's imagine going to a food bank, and the value was £2,500 for that activity per year by the person benefiting from it. You've got to multiply 1,000 by you've got to multiply 100 by 2,500, and you end up at 25,000 or 200, whatever the figure is. You multiply two numbers together and you come up with a bigger figure. So 3 things that we looked at, and this is applicable to other heritage organisations. The value of volunteers. There's a well-being value of volunteering. Taking part, so we estimated how many volunteers there were each year in churches. We worked it out. We had a couple of big data surveys. About 1.3 million people volunteer each year in churches. So we multiplied one figure by another. We came up with a figure. The benefit of volunteering is £165 million a year. Okay, so that was value number 1. Then we looked at the community support. That's the things I was talking about, like food banks. We looked at 4 things in particular: food banks, counselling and mental health, youth groups, drug and alcohol support. We saw yesterday that there's that church in Manchester that's now a redundant church. Your church, was it? 1 minute, okay. I'll get really quickly. I'm done all the figures. So okay, so the second value was the community support. This was a huge figure. Came out at £8.3 billion of value. Okay, the third one is attending church. It's not a religious value. That's the fact that you're together with other people in a building. It can happen in other heritage buildings. That's 1.4 billion quid a year. Okay. After we did this, that figure that I spoke of £2,500 per Wellbe was increased by the Treasury to about £13,000 a Wellbe. So all our figures that I've mentioned here went up 5-fold. So increase all that value by 5-fold, and you come up with a figure, including some market value, of £55 billion a year. The value of church buildings to the UK. Okay, so very quickly then, I won't give you the table. What we're doing now is we're producing a local calculator, which will allow every church to put in its own numbers of people doing this, that, and the other, and we'll come up with a figure at the end. So your church might be what we've done, some pilots. It varies between, like, my church is worth 200,000 up to 3.5 million. So allow a church to value its own benefit, which could be of use in fundraising with a local council, even if the diocese wants to close it down. So we're doing that. We're going to be releasing that later this year. We're also doing some work on loneliness, looking at how churches and what happens in churches can help combat loneliness. The figures are very elusive because it's very hard to show a causality between attending a lunch club or going along to something. Have you really, is it attending that's increased your well-being or not? Hard to know, but we are looking at that area, and we're going to be producing a report in that later this year. We've also somehow managed to find a figure that I'm wrapping up now that shows the well-being value that you get from visiting a historic church. Okay, that comes out. We've worked that out. That's about £850 a year per person who visits a historic church. If there are around 12 million people who visit churches each year as visitors, the value to the UK of people visiting historic churches, there's some caveats to this, is probably around £10 billion a year. So what I'm trying to say here is we've looked at the sort of the big picture here, because we want to make a case to show people that these buildings are worth putting money into to keep them open because of all the well-being that happens in them. Yes, they've got heritage value as well. They might have value because they're religious buildings, but they have a huge well-being value. And I would suggest that lots of other buildings, activities that go on have, if we were able to gross up all the heritage activity that happens in the UK and work out the well-being value, enormous.
Thank you, Annie. Well done. Whoa, amazing. You got faster as well. That's brilliant. I'm exhausted, but we're going to change the order just to keep you on your toes. And Leslie Hardy from the Diocese of Canterbury and Town of Heritage is going to talk about surveying the sacred church's well-being and contemporary antiquarism.
Thank you, that's very kind. Do come up to the front if you get, these are lovely large ones, but I've got some pictures, so the pictures might be of interest, I don't know.
You know what John Betchman said about the first row of pews in the churches, that it was safe for people who never came to church, and I feel like I'm kind of slightly have that. So please feel free to move forward.
So hiya, I'm going to add somewhat to our last speaker's excellent presentation, which was very, very interesting. And what I hope I'm going to add is a sort of reflection on some of those figures. So I'm not really here to talk about a project, to be honest. I do have a project. My project is called Surveying the Sacred. but I'm not really here to talk about the project. I can answer questions on that if you want later. I'm really here to talk to you about the ideas that underlie and underpin it. I am a Korean television addict. And there is in particular, historical Korean drama is my thing. This isn't actually. This is from a thing called King the Eternal Monarch. But look, the thing is this, popular culture is riddled with this thing that we know about, but we don't really talk about. And that is this sense that is inbuilt in all of us, really, I suspect, of timelessness. So in this scene, you have to imagine it, right? They're in a telephone box. They're separated by time and dimension. I won't go into the detail. But they're in a telephone box, one in one dimension, one in another, okay? And they are actually connected. A lot of what we talk about when we think about the experience people have in relation to spirituality and faith is about timelessness. And that has enormous, and that sense of being liberated from here and now, liberated from mortality, actually, liberated from that sense that, you're just a person who's going to live and die, and that'll be it. And connected to a sense of transcendent timelessness. That's why we like old places. And that's particularly why we like old churches, because they explicitly talk to us about this stuff. Okay? Right, here we go. I'm not going to blind you with details. This, for example, is St. Martin's Church in Canterbury, which I know very well. It is the oldest place of continuous Christian worship in the country, probably. And it's an extraordinary place. You open the doors at St. Martin's. It's not in the centre of Canterbury. If you know Canterbury, it's on the outskirts of Canterbury. You open the doors, and the doors are not open every day. And people just drift in. They drift in their thousands. Over the course of a year, they just drift in, they come in. It's a particularly interesting place. But I've got that here because I want to say something to you about why churches matter. Now, I'm sorry, Eddie has already really done that job for me, so I'm going to just skip past that. But churches are an extraordinary heritage asset. They are the single most important heritage asset in this country. And what you might know, Eddie certainly knows, in practice probably keeps him awake at night, is that we are like lemmings running towards the edge of a cliff, because our capacity to keep these churches open and functioning is going to collapse. It's not going to go downhill slowly. It's going to collapse suddenly. And that's because of the demographic of the people who pay to keep these churches open. Okay? So this is this is the reality that we have to confront. And nobody really, with the honourable exceptions, is dealing with that. My church, this is I have 5 churches, all grade 1 listed churches. This one is in Wingham, which is a village just outside Canterbury. It is a early 13th century canonry church. It's an extraordinarily important church. It's almost like a small cathedral in size, and it is falling apart. It has been on Historic England's at-risk register for many, many, many years. More than 943 places of worship were on the at-risk register. It's gone up by about 40, I think, in the last year. It's a crisis. Okay, why? I'm just going to say something very briefly before I get on to nostalgic antiquarianism. I'm just going to really in response to what Eddie was saying I want to say something about the quality of what goes on in churches and the nature of it. I query the idea of volunteerism. Churches don't attract volunteers. The whole language of churches is distinctive. They are distinctive heritage places. You can have concerts in them. You can have meetings in them. You can have dementia cafes in them, but they are not just concert halls. The whole nature of what they are is like imbued in the fabric of them. Because like it or not, and we tend to be a bit embarrassed about saying this, they are the product of loving attention created over hundreds and hundreds and hundreds of years. And the faith and the belief systems that have created them can't just be erased because they're inconvenient to modern thinking. They are expressions of faith. And those of you who are historians here know that increasingly history is dealing with the fact that it has to recognize and accept the belief systems of the past. It has to take them on board fully in order to understand what's going on. Right, I'm just going to say that. Now then, I'm really attracted to this idea. It's a woman called Margaret Aston in 1979 wrote an article. I can tell you what it was, those of you who are interested. Hang on a tickety-boo, it's worth knowing. It was an article written for the Courtauld Institute in 1979, and it was called I don't know what it's called. Here we go. It was called English Ruins and English History. English Ruins and English History. The dissolution, that is the dissolution of the monasteries, and the sense of the past. Now, those of us who are interested in history and antiquarianism, I'm conscious that many of us here are archaeologists. I work closely with archaeologists, but I'm not an archaeologist. Archaeologists get very queasy when you talk about antiquarianism. But antiquarianism can't just be erased. It is an extremely important way of thinking about the past. And it's a particular and distinctive way of thinking about the past because it combines a sense of trying to rescue things. There's a well-established belief, Margaret Aston is one of those who established this principle, that the antiquarian response of the 16th century, the development of the work of people like Leyland and so on, then Camden and Lambarde, Stukely, I could list them going on and on and on, right? That was a response of grief to the consequences of the Reformation. It was an attempt to rescue something that was disappearing in front of their eyes, okay? This is essentially what Margaret Aston argues. It's particularly focused and poignant in the fabric and the nature of churches, for obvious reasons. Churches are places of memory. They are places of collective memory, and they are places of burial. They are places of great expression and art. Okay, so just a few pictures here. This is Aubrey's antiquarian drawing of Malmesbury Abbey. This is Blake, actually, William Blake. This is his work on Westminster Abbey from Richard Gough's Sepulchral Monuments of Great Britain, and it shows the body of Edward I in his tomb. Can you see it? So it's this kind of sense of life and death, life and death. It's like in your face in a church, but it's also, you're also held and it's kind of explained. Here's another one, have a look at this. This is William Dugdale's History of St. Paul's Cathedral, the old St. Paul's Cathedral, the old St. Paul's, which was devastated during the Commonwealth and then, of course, burnt down in the Great Fire of London. Dugdale produced in 1658, just 2 years before the Great Fire, produced an extraordinary antiquarian record of that church, an elegy. Churches then offer us the opportunity to engage with layer upon layer of reflection, a sort of elegiac, nostalgic sense of the past, but they also offer us the opportunity to be creative in our response and to bring past and present together in a kind of creative way. Okay, so they're just really important, distinctive places. Here's my question. Where else does heritage and well-being come more closely together than in these places of shared inheritance and expression, community, in imagination, loss and hope. Loss and hope. Okay? These are the places that really matter. I don't know how much longer I've got. Okay. I'm just going to go. I'm not going to race, but I'm going to go. So this is my second concept. So you've got antiquarianism as an idea, loss, hope, and all of that, right? So my second idea that I want to talk to you about, which I'm attempting to bring into my project, is this idea of relics. I'm going to say something about that because I did a lot of work on a project around an Anglo-Saxon saint called Eanswyth. I don't know if you've ever heard of Eanswyth. Eanswyth was an Anglo-Saxon royal saint, Kentish royal saint. And unlike nearly all of her contemporary Anglo-Saxon royal saints in Kent, whose relics were destroyed at the Reformation, Eanswyth's survived. And we know that because they were rediscovered in the 19th century, hidden in the wall of a church. Okay, look it up, Eanswyth, E-A-N-S-W-Y-T-H. It's very interesting. So a lot of work around relics, and that leads us to this point here. I'm going to give you, for example, the work of this great historian, David Brown, who's a really creative and interesting historian who works in the field of late antiquity. So David Brown talks about why people think about relics, or what they're doing with relics, and the cult of relics and the cult of saints in late antiquity. And he makes this point. He says, in late antiquity, you know, where people were, this isn't from late antiquity, it's medieval, obviously, but, you know, this notion of proximity and touching relics. What lies behind that, Brown says, is this notion of that in the ancient world, the divine is kind of layered off in a kind of almost a kind of physical way from the material. So you've got the material world, you've got a kind of dome, and then you've got the divine, okay, floating around up there. The point about Christianity is it comes along and it says that's not how this is. God is in the material, okay? And God is in the material form. So Christianity has this particular kind of contribution. And he talks about, very interestingly, about this idea that in early Christian thinking, the saints were both at one and the same time present in the relics or the shrine and in heaven. Yep, okay, 2 minutes. So this, again, we're back to this notion of proximity. Now, what I want to say to you is there's something about churches that allows us this really, I mean, it's somewhat esoteric, this, but it is a really interesting potential thought if we're talking about well-being, which is not just physical well-being, but is spiritual and emotional well-being. It is about proximity to the other, okay? So very finally, my project, if you want to know about it, I'm happy to talk to you about it, but this is what we're hoping to do. We build on, this is the third in a series of projects we've done. This is a project called People Before Us, where basically what we did is we thought we're gonna survey a churchyard, and what we found was people just wanted to connect with the gravestones and the art. This is where antiquarianism matters, because it's about this focused concentration, this recording, and in the process of recording, rescue, engagement, transcendence. And the reliquary stuff matters because it gives us the potential sense of why this material culture matters spiritually. I hope that makes some sense to you. Thank you very much.
Thank you very much. They were a kind of really interesting, like totally different presentations, but actually together they make a kind of magical combination, I have to say. So thank you for that.
She got to use the word transcendence, I'm afraid.
Yeah, she did. She did get the points for that. Right, we are now going to move on to something slightly different. So I presume I just go to the beginning of your thing. Okay, should I play when I say go? So no, I won't play. Are you sure? Okay, I didn't want to like mess up your... Okay, so I want to introduce, I'm just looking so that I get everybody's names right, sorry, because I'm going a bit mad. Sorry, right. I just want to introduce Susan McCrory from the Charterhouse in London, and Peter Ayres, whose name I do know because he's an old friend of mine, which I'm really pleased to have both of you here today. And you're going to do something slightly different. You're going to talk about the Charterhouse, which is an active, living place of worship, but also houses individuals that live there, both men and women. And Peter is the master of Charterhouse and chief executive. Is that the right term? Yeah, you do lots of posh things, right? And live in the middle of London, not that we're jealous. So you're going to do a kind of conversation, and I'm going to run the slides, and you're going to talk about community life in an ancient site.
Thank you, Linda, for that lovely introduction. So I'm Peter Ayres, I'm Master of Charterhouse, and this is Susan McIlroy, who I will let introduce herself and describe why she's here.
Yes, thank you so much. My name is Susan McIlroy, and I actually live at the Charterhouse. I don't know how much you know about the Charterhouse, but we're going to let you know in a minute. Peter has said so. Yes, I've been an educator for most of my life, and I've lived at the Charterhouse for 3 years. So
a quick history of the Charterhouse to give you a bit of context. It is a very peculiar place. It started out as a field owned by St Bartholomew's Priory, which now you will recognise probably as St Bartholomew's Hospital and Great St Bart's, the church over there. It was leased in 1348 to be a burial ground just outside the city, the walls of the City of London, to bury the dead of the Great Plague, which happened in that time, 1348, 1349. Now, later on, there was a desire to build a monastery to pray for the souls of the dead who were there. And so the land was actually bought by a man called Walter de Manny, or Walter Manny, who was a knight of Edward II's, and they built a Carthusian monastery. And it's now called the Charterhouse. Now, do you know where the Charterhouse comes from? It's got nothing to do with charters and nothing to do with houses. It's merely the mother house of the Carthusian order is in the Grand Chartreuse. And if you translate Chartreuse to central London, you get Charterhouse. So that is why they're called the Charterhouse. Not necessarily London, because the first one wasn't in London. It did really, really well up to 1535, when Henry VIII decided that he no longer wished to be married. And there was lots of issues that occurred. The Act of Succession to secure Anne Boleyn's children in the line of succession. And then the Act of Supremacy. And the Act of Supremacy, it was really binary. Is Henry VIII going to be the head of the Church of England or not? And he was. And the monks disagreed, and 4 of them were taken off to Tyburn and were hung, drawn and quartered. And every 4th of May, we still recognise that very brutal event that happened in the history of the Charterhouse. It fell into some meanwhile use. Lots of famous people lived there, including the Bassano family, who were musicians, John Leyland as well. And then in 1545, it was bought by Lord North and turned into a very well-appointed mansion house just on the outskirts of the City of London, but effectively still in the countryside. It hosted Elizabeth I's first Privy Council, and James I's first Privy Council were also held there. And it was owned by the Duke of Norfolk, who got his head chopped off in 1572 for treason. I'm just developing a theme here. Then it was kept as a mansion house until 1611, when it was bought by a man called Thomas Sutton, who left his vast wealth to form an almshouse and a school. The school left in 1872 to go to Godalming, and still Charterhouse School thrives today. I had lunch yesterday with the chair of Charterhouse School. Still very close connections between the two things, but amazingly, since 1611, we still continue to be an almshouse with a difference. And this is the important point. So we house about 40 people, 40 older people who live in the Charterhouse. And it's a very different experience. Normally, almshouses look after, sort of just provide accommodation, but the Charterhouse is slightly different. And I think it all relates back to the Great Hall. So I'd like, Susan, maybe you'd explain what goes on at the Charterhouse and why it's different.
thank you. Well, we live independently at the Charterhouse, but in the knowledge that we have a ready-made community there for us. And that ready-made community really involves some traditions which really keep the rhythm of life at the Charterhouse alive every day. And one of those traditions is we have 2 great halls at the Charterhouse, and one of them is the Great Chamber and the Great Hall. And we eat communally in the Great Hall. And this probably causes the most amount of discussion with anybody that visits, with family, friends, anybody that says, well, how can you all eat together? But it is, when you come to the Charter House, you know, it is a community. And people often ask, how do you do it? Well, how we do it is when you arrive at the Charter House, you get assigned a seat. And you have that seat going forward. I actually share a table with 7 men, which is wonderful, absolutely wonderful. And people say, well, what are the benefits of that? Well, we have breakfast, lunch, and supper. Breakfast and supper, quite informal, but lunch is very formal. So if you ever have any guests, you have to remind them before we go in, we actually stand for grace before and after the meal. Peter is generally there, he bangs the gavel, he says grace for us, and we get on with everything. But there is, what I'd like to say is, because people sort of say, well, how do you do that? Well, how we do it is because it is all about the community, and sitting at a table with 7 people, sometimes for 2, maybe 3 meals a day, you get to understand people, and you also get to understand how they are. And coming to the Charter House, we were told, you know, that it's good neighbour practice, and that good neighbour practice really does kick in, because we are with older people, and sometimes older people aren't very well, or sometimes they need a little bit of help, they may need prescriptions collected or whatever, and that's really how it works. But it's a fantastic community there, and very much so. When you arrive, you are asked, what can you contribute? And certainly for us at the Charter House, you know, we're given all options of volunteering, being guides around the Charter House. You can volunteer in the garden, you can volunteer certainly in the chapel. There's lots and lots of activities that go on there. So really, it really is a very, very, you know, I would say it's not a care home there. It really is a vibrant almshouse, which you really can get involved in.
Yeah, I think that's an important point to make. And also, we do work very hard to try and ensure that all of our community, they're referred to as brothers. And some of our brothers don't necessarily agree with being called a brother. But it's which is an interesting debate in itself. We try very hard to look after our brothers until end of life, as well as that. So we have a registered care home on site, and we're focusing quite a lot on what does it mean to age in the 21st century with a 100-year life looking ahead to us. I was just interested, maybe people think you might live in dormitories as well, Susan. You might want to explain what your accommodation's like, rather than just...
Yeah, it's not a dorm, you'll be happy to know. I actually live in a 1-bedroom apartment, which really does allow for independent living, and we can be as private as we wish. So it's really quite normal living, yes.
Just to reassure everybody. So we have a 7.5-acre site in central London, and I think, one, the location of this site is important, and part of our strategy is about place. And you probably talked a lot about place and well-being over the last couple of days. The thing is that our trustees, our governors as they're called, could sell off this site and make a load of money. It's a very valuable site. And they could reinvest that building a purpose-built building somewhere else, like maybe Frinton-on-Sea, which could maybe benefit more people. But actually, we think there's inherent value in being in this historic site. And I wonder, Susan, if you might reflect on how you feel about living in this place of great history right in the centre of London.
Yes, I mean, it's just glorious, really. We are in the centre of Barbican, but I have a sense of pride about where I live, and I really think that's shown in certainly whenever I do any guide work, or I'm helping in gardens or whatever. I just feel that we are just so lucky to be where we are, and what we really want to do is certainly, you know, share and open our doors to everybody else that's coming in, and allow them to, you know, share what we have at the Charter House.
Yeah, I think that's quite important. So the Charter House was closed and had no women up to about 2017. So we're quite late adopters of. So you're at the cutting edge of almshouses in London, Susan, and it's made a big shift actually. And actually, having people visit the site is really important, and it does help with the pride of the community who are there, and we really want to share that. To take it a bit to extremes, the reason Susan's here today really is because she's been at the forefront of a group of our brothers who've decided that really it's not enough to open up to the public free of charge for the museum and the heritage aspects of the site, but also they felt they wanted to do a bit more, and they've created something which started off as warm space, which has become community space. And well, you'll get an invite at the end of this, I'm sure, but if Susan, you'd explain the thought process and then what it is.
I mean, saying that we're very proud of where we live, we just wanted to sort of see what we could do to open our doors and connect with the community and the wider community. And it was really perhaps, well, quite a bit after lockdown when, of course, the economy was really suffering and everybody was trying to sort of get warm spaces going. We decided, let's look at what we've got. What can we do with what we've got to help, those outside? So we decided we would create a warm space, and we asked Peter if that's what we could do. He gave us the chapel cloister on a Friday morning between 10 and 12. So we had the place, we knew what we were going to do, had a small team of brothers that came on board, and we decided, yes, that's what's going to happen. But what we also did is we went out into the community. We went to, can I say Gail's Bakery in the community. Yeah, sorry. Great people. Yeah, they are. We went to Gail's Bakery. Actually, Peter came along. I was in there one day and just saw a little card that said, if you are a charity and you would like to help us with our leftovers, please come. So I did that, mentioned it to Peter. We went along, and now we pick up every day from Monday to Sunday. Yes, we do. And we have pastries, because what we wanted to try to do was make it, so that we were funding it really, that nobody had to pay anything. We then went off to Waitrose, and lovely Mr. Harris at Waitrose gives us tea and coffee. We do pay for the milk ourselves. So what we do every Friday is we set up this lovely little cafe in the chapel cloister, which is so atmospheric. People can come in. They can, tour the museum, which is for free. They can go into the chapel, and they can sit down and, either by themselves, if they just want to contemplate, they can do whatever they wish. But we have brothers in there who sit and chat with them, and they have free tea and coffee and a pastry. And Mr. Ayres comes down every Friday and doesn't miss it. He complains bitterly about the coffee, but he likes the pastries. So, but what we've found is we've got people that are returning, it's just every walk of life that's coming through the door that just sits and enjoys, what we have to offer. So it's worked extremely well. As I say, probably in the first year, we've had over 1,500 people come through the doors, and, a lot of those return. It's brought lots of people to the Charter House. Certainly if they're not going on a tour, they just want to come in and have a look around, and certainly join us for a tea or coffee. But yes, it gives us a sense of pride. I'd actually say it's probably my best day of the week, because I walk away from there thinking, yes, we've achieved something today. We've given something back. So is that enough?
It's really important, and it gives me a sense of pride that the community is connecting with the wider community outside. It's quite powerful stuff, and genuinely, if you're in Clerkenwell, Barbican, just in the city, 10 o'clock to 12 o'clock every single Friday, come and have a cake and a chat, and we'd love to see you. But I think we're out of time now, so thank you very much, Susan.
Thanks for that. That was really, really brilliant and really refreshing to have a kind of variety of presentations. A couple of things struck me. One, that there is a thing which is the cutting edge of being an almshouse. I really love that idea. There is a cutting edge to that. I think I also really love the fact that it really challenged my idea about what an almshouse is from somebody that's never actually had any reason to access one except drive past them and go, oh, look, an almshouse, how quaint, you know. And I think the other thing that really struck me, we talk about lived experience, don't we? It's kind of like people that work in organisations and policy organisations and delivery organisations and heritage asset curators. We sort of talked about lived experience if it's some kind of other weird thing. And other than the fact that clearly living in the Charter House is some slightly weird thing, so just setting that to one side. But actually, what I really loved about hearing you talk was that it isn't that we're going, oh, do tell us how you experience the heritage. What I heard was that you've kind of created a virtuous cycle out of the heritage and the location and the place that you live, and that you've kind of brought it, like the bringing people back in, like is part of the living there. I don't think I've explained that very well, but I really got a sense of round completeness from the way that you've kind of like encouraged people in and how you've worked and how that's really grown out of the community. So I thought that was fab. Thank you so much. We've got, I've just put down, I'm going to have to stop your beautiful presentation to look at the time. Right, there is a wellbeing walk at 10 to 4, I believe, outside the front door. And I don't want to prevent people from just getting some fresh air if they need it. So we've got time for a couple of questions, but I'll probably then give you a couple of minutes to run to the loo and grab your walking boots. So are there any questions for anybody? Yes, oh, I've got one of these.
Thank you. I found those sessions, I think, my favourite of the whole 2 days. So thank you. And that's not just because I know Eddie and Peter. I thought they were all brilliant. And I was very impressed, Peter, that you managed to get your dog Bertie on one of the pictures. I spotted him. I wanted to ask Eddie, I found that really useful. How do I find out more about the Oxford University Wellbeing Research Centre? And have they done anything specifically on heritage buildings?
I don't know. Google them. Yeah, they're part of Oxford University. I think they're all in New York at the International Happiness Summit, which took place yesterday, which I stood down and came here instead.
Yay.
But no, do, and they've got, you know, they're not of economists and sort of thinkers, but absolutely, I can work with you on that. Yeah. We can go to Oxford together.
Or New York?
Anyone else? Questions? Yes.
It's a question for Leslie, Peter and Susan, because it's specifically about sort of actions. I still can't get my head around the fact that places are providing warm spaces. That seems to be utterly nuts. You know, if we were saying to people 5 years ago that we'd be providing places for people to stay warm as a result of challenges that they're facing in their own lives, I find very strange. But I suppose the question for Leslie, Peter and Susan is, coming out of that, do you think there is greater pressure on organisations like yourselves, as churches, as almshouses, to provide this kind of well-being support? Because it almost seems like you're filling a gap that the state used to provide those kinds of things and is finding it increasingly hard to do so. So therefore, do you think there's a greater pressure now on organisations or locations like yourself to provide that kind of support?
I'll start because these guys want to speak about churches, and I think they're very different from what we're doing. I mean, we were there before there was the state providing this kind of stuff anyway. That's where we came from. And now what we're finding is always been thus, is we're still filling in where there are spaces and there's not that provision there. But we work very hard with the local authorities, NHS, to try and get the best out of people's lives as they get older. But it's getting harder, definitely, and it requires a level of sophistication. And if you don't have advocacy, which is effectively what I would argue we provide on behalf of the brothers, for those brothers who don't have families, quite a lot of people who don't have families, quite a few do, but there are quite a lot that don't. Advocacy by people who know what they're talking about is hugely, hugely significant to the outcomes that you get from that. And just to say that we evolved warm space into community space because we kind of changed its nature just because we wanted to do that. So.
Did you want to answer that?
Just two things. Very good question. Very good question. One thing, if you look back 200 years ago, of course, where was all the social support or even education? It was provided by the parish, and the church was really important then. And then, then came along, municipal authorities and town councils, and then the welfare state post Second World War. A lot of that's hanging by a thread. So yes, for better or worse, churches and other organisations, as we heard yesterday, the Baths, the church in Manchester, they're stepping in to fill that gap. Churches, in a sense, can provide some of that for free because, they're not profit-seeking organisations, but they're stepping in to fill that. And also the thing about churches is that they need to do that because there are fewer people coming to worship. So they've got to have a purpose. And in talking about volunteers, actually a lot of people who do stuff at churches, food banks and so on, they may not be members of the congregations. They may not even be Christians. It's just a building that sometimes is great heritage. And it's a space that these things can take place in.
Sorry, very briefly, just to go back to your point. I'm sorry, I don't know your name. Linda, just to go back to Linda's point. And I think this is the key thing here, that what makes all places of worship distinctive is that let's say their charitable activity or their communal activity, community activity, or whatever, is inherent in what their identity is. They're not castles, or their identity is deeply connected to community, well-being, charity, whatever you want to call it. That's the fusion. So when you're in a church and you're thinking about heritage, you are inevitably thinking about well-being.
Right, I'm just going to allow Jo one last question, and then I'm going to release you.
Sorry, I don't want to keep you. I'm really struck by all the different components that are coming together that you're talking about when you're talking about your experience. And of course, it's set within a very historic environment. But I guess a question for me is, how could you take that model of living to people who don't exist in those environments? What is it that you could take out of that and put into a 1960s housing estate?
Good question, Susan.
It is a good question, but does it really matter where you are doing it?
I think that is my question.
Does it? Yeah, but does it? Yeah.
How do we transpose those qualities that you're experiencing to other places? I guess that's my question.
I'm not sure. I'm really not sure.
I guess the question is, to what extent does it depend on being in that environment, and to what extent are there elements of the model, the living together, the support, the brotherhood, the religious kind of conceptualization of being in the way that are part of that experience, that could be shared. I don't know, maybe that's too big a question.
It's a big question.
I think it seems to me, I'm just going to just steal the microphone. No, I think it's really difficult to be put on the spot like that, but I think it's a really good question. And I think there's something about, if you extrapolate the qualities that we heard you talk about, that is partly about connection, it's partly about that sense of community, it's partly about that purpose, it's partly about that neighborliness. And it's almost like, how do you support other communities to ensure that all of those characteristics, even if they're not living in a historic quadrangle, like there's something in how do we transpose that I think is behind your question. But I do also think it's quite a big, mind-blowingly complicated question. Yeah.
Two things very quickly. One is the sense of time. People have been in the Charterhouse. People in the Charterhouse have been there for hundreds of years. So that must give you a sense of meaning or purpose or understanding your life as you're getting older, which you might not get in a building that's 30 years old. And also the quality of the architecture must have something to do with the quality of the built environment. All right, you can do things perfectly well in a brand new building, but you can do it really better if it's an amazing modern building rather than just something that's off the shelf. So quality in the built environment, I think, is really important.
And the thing to bear in mind, there's a book by a man called Andrew Rumsey, if you get a chance. Who's the, do you know? Yeah. Okay, so who's the Bishop of Ramsbury? But if you read his book, it's called Parish. The whole of this country is divided up into parishes. Every part of this country, urban, suburban, rural, has a parish. And the parish has a church. And the parish is the ancient center of exactly this kind of historic community. It's the point of meeting between history, tradition and geography, if you like, and community. And so every place, there is no place in this country that you cannot access these patterns of tradition and antiquity. Every place is within a parish.
I think that is really helpful, but I do think there's something more to your question, Joe, which is about kind of complex social interactions in places that are not necessarily centred on a parish church as well. And I think that's why it's different, if I've understood you right. Anyway, it feels like that's a really complicated PhD that we probably need to sort out on another occasion. So go and have a coffee. Please, 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 please come back at 4:15. Historic England will be launching its new research on life satisfaction and well-being, never to be heard before. Sneak preview in the Times this morning. But please come back and listen to that, and we will see you in a bit. Thank you very much. Sorry. Yeah, no, it's okay. Oh, God, it's working now. God, I hate it when I do that. I'm so sorry. Okay, well, thanks for staying to the end, guys. I really admire your resilience. Sorry, can we just... Sorry, I just can't concentrate and have people talk at the same time, sorry. I think it's just the end of 2 quite long days. So thank you very much for staying. We are going to hear from Tom in a second, but there was just one thing that I wanted to do first really quickly, which is that we've talked a lot about how Delapre have done brilliant things, and I have to say, a conference with party bags is literally my dream conference. It's the thing I always hate, like when you're a kid, you get party bags, and then now we allowed them again. So thank you to Delapre for our surprise party bags. And secondly, I did just want to say an extra thank you to Desi and Claire, because we could not have done it without you. So I bought you a little present. I know that Rich is sitting there saying, yeah, but you haven't actually paid for them yet, Linda, so don't say you bought them. But we're going to resolve that straight after this. No, genuine thank you for all the work and the late nights, and please take some time off. I'm not your boss, but I'm sure Neela will agree. But I am Desi, so she can definitely take some time off to recover. So I just want to say thank you to both of you. And then I just wanted to introduce Tom, who's a Historic England colleague of mine, who I'm now going to embarrass because I feel that's appropriate. So Tom's I always think you come across as kind of quite modest and unassuming, but what you don't do is make it obvious that you have this kind of like incredible brain that is the size of a planet when it comes to understanding economics and statistics and controlling factors, and actually the work that you've done, which has been funded by DCMS, which is part of our cultural heritage capital work, is phenomenal, and it's launched today. The Times, page 3 of the Times, did a big spread on it, which is actually very impressive. And I think it's the kind of data that we will use literally for the next decade to demonstrate the power of heritage. And I cannot say that strongly enough about how important I think this is. So I'm really happy you came to talk to us. Welcome to the floor, Tom.
Next, awesome, thank you. Yeah, thank you very much for that introduction, and thank you for staying here to the end of the day as well. I'm going to be talking about a report that we released today. It's got the really exciting title of this, Cultural Heritage Capital, keep everyone happy with all the different things we need to mention in the names. I'm going to go straight into it. So I just want to give a brief idea of what the Culture and Heritage Capital Programme is. So it's an interdisciplinary approach to trying to better articulate the value of cultural heritage, something that we've traditionally not been very good at, and that can lead to not the best investment decisions for heritage. I think we're probably acutely aware that in the last 10 to 15 years, basically everywhere has been cut, and places that aren't health or pensions or maybe education have really taken the brunt of those cuts. So if we can demonstrate the value of heritage better, we can get better outcomes for heritage. So it's economics-led, but it's built on culture and heritage science and practice. And that's really important because heritage is actually often at direct conflict of the traditional economic measures we have. Everything that you will ever learn in economics says that as things get older, they deteriorate and they get less valuable. But with heritage, it's actually something quite different to that. We actually might see an appreciation of value. And it also undervalues the level of things such as your bespoke value, the value that you have of keeping your heritage for future generations. They all kind of break our normal economic models that we have, so then we must do something to sort that out. You can take kind of this place here. If we just used our traditional economic metrics, we could say, yes, you can pay for an event space here, there's a cafe, and there's some tourists that come here. But that would completely not value all of the amazing things that can happen here, even taking the last couple of days, all the knowledge transfer that has occurred within this building. Those sort of things can't be measured currently with our current methods, and that's kind of what we're aiming to get to. And it's going to be long, it's going to be slow. It probably outdates anyone that's at Historic England now until we can kind of get this in a really good state that we're happy with, but we've begun to do it. I've kind of touched on all of this here. So the kind of why do we need it is that we've got no approach to doing this at the moment. And that means that it can lead to culture and heritage even being valued at zero, even though it has all of these non-market values. And then this is the DCMS bit. We've got the increasing need for DCMS to provide leadership. They are the people who are kind of governing this program. And then we're working with, they work with us, Historic England and Arts Council. And then we've brought in a lot of different academics. There's arts and research humanities funding and all sorts of other people involved. And then the key outputs of the program is firstly to get a bank of evidence of values for a range of culture and heritage assets. Then the supplementary guidance to the Green Book covering heritage capital. And then finally, a set of national culture and heritage capital accounts. And this is one of the first attempts to try and really do this now. So moving more onto the paper that we produced, these are some, a really short literature review of the type of methods done before to try and value how much heritage impacts your life satisfaction. At the moment, these are largely based around participation rather than passive and the kind of use that we do every day today. So we know quite concretely that going to visit a heritage site maybe once a month will have a noticeable impact on your life satisfaction. We can know that about mental health as well. And we also see quite nice things, I would say, and some negative things. We see that people in areas of higher levels of poverty, the effect of going to see heritage is actually significantly more. It has a better impact on your life satisfaction. However, on the contrary to that, we find that people's access to heritage is often less for people who are in areas of higher levels of deprivation. So it's a bit of a mixed bag, but we know those positive impacts exist. So then the research question that we were kind of asking is we wanted to know, is there an association between the density of culture heritage assets and their proximity to the residential areas? So that's your day-to-day encounters with heritage, not going to see big heritage sites, not going to, going to an English heritage or a National Trust site. We want it to be the day-to-day experiences. And does that exist after we control for individual and regional factors? So all of the things that we think that might impact your life satisfaction. And then the next question we were asking is, do different types of listed heritage assets influence the self-reported life satisfaction scores differently? So we had to think of a way that we can do this, and this is kind of how we came up to do it. So at the bottom, you've got the National Heritage List for England. That's what we call our dependent variables. That's what we're measuring, independent variable, and that's what we're measuring everything. And then what we did is we went and looked at what data can we get on that might impact your life satisfaction. And these are all of the ideas that we've basically come up with that might impact your life satisfaction that we can observe. Obviously, a large amount of people's happiness is based on unobservable characteristics, and we struggle a little bit more to do something with that, but that is the nature of this type of research. So then with that National Heritage List for England data, there's about 400 designated assets in the data set. If you map it, it looks like that, which is not very useful at this point. But it consists of listed buildings, monuments, registered parks and gardens, registered battlefields, protected rec sites, and World Heritage sites. If you're wondering what that looks in like a heat map type of way, it looks like this. This is technically a kernel density, and I'm not going to bore you with what the difference is between that, but red is indicating higher spots of it. Lighter colors are indicating less spots of it. And you can see, although you do get your patches around London, etc., it's pretty well dispersed across the whole of the country. On the left-hand one as well, you can see that the London doesn't come up as much, and that's because you basically, with London, got this really small point right in the centre that no one actually lives in. And that's not very useful if we're talking about day-to-day encounters. So the next question we had is then, what geography level could we use to do this? We wanted this to be as localized as we could possibly do. We want it to be about your day-to-day encounters. So you have output areas, which are the smallest geographical unit we have. And then we have local super output areas, which are kind of the next one up, and middle super output areas. We found that we could get as much data, the kind of optimal point of data that we could get was that local super output area. So we chose that one. So it covers about maybe 1,000 to 1,200 people living in one of them at a time. And then the next thing we had to do was basically think, how can we make this useful? So rather than just counting the number of heritage assets within those LSOAs, we thought, let's draw 1 kilometre centroid rings around the population weighted centroid. And I hope I'm not losing anyone here, but basically that's where on average people live in these areas. So if we draw 1 kilometre around that, depending on how fast you walk, you're talking about maybe a 10, 15, 20 minutes within your residential house to be able to walk around. If a heritage asset doesn't exist within that 1 kilometre, we don't count it. It's not something that we're considering that you can encounter in your day-to-day lifestyle. This is quite a nice way of it looking, but quite often it looks like a huge mess, especially once you get into the more inner city areas. But we run this all through some GIS software. It's repeating itself. Now, this looks absolutely horrific up here, but basically what we're saying here is that we've got life satisfaction on the side, so that's our measure of well-being. It's reported as a level of 1 to 7 in the Understanding Society data. We then take that variable that I just talked about with the 1 kilometre centroid rings, we throw that into a program, and then we throw all of those other control variables that we discussed earlier on. So that's household income, number of children you have, your ethnicity, your religion, anything we can observe that we think might impact your life satisfaction, we can control for that. And basically what that does, it takes away the element of what we might predict is that people who are in higher areas of in areas of higher amounts of listed buildings might be happier, but that might be because of other factors. We could probably safely assume that household incomes, for example, of those areas might be higher. So we need to take that away from that when considering that, and we need to isolate just that heritage element of it. And that's what we do through this regressional design. If you had economists here, it's actually not too difficult, and actually you just click a few buttons and it can do that. But the data side is the more difficult bit of it. And then we get this really horrible, absolutely horrific looking table. And again, I'm not going to bore anyone with all the details. Minus means it's negative. No minus means it's positive. And the stars signify how sure we are of these results. So we're saying how significant these are. So the big one that we're really interested in is that top one. And it's positive, and it's 3 stars. So that means that we are really confident of what we're finding. I think the actual statistical chance that this happened by chance is probably about 1 in 10,000. The kind of barrier we need it to be at is 1 in 20 to be able to go and release it in any kind of journal. So we're in the real areas of this hasn't really happened by chance. You can get some funny things here. So once you control for every factor influencing outcome, obviously on average, and it doesn't speak to anyone individually, you get funny aspects of having children apparently makes you less happy. Bit of a funny one. Women are always happier in these studies. I don't know if that's just because they rate themselves happier or whatever reason. And again, this is after you control for all of the other factors. So this is just a few of them, but we've got lots and lots of other controls within this thingy. So we control for stuff like your health, whether you own your own house, and more basically. So with that, and it was touched a little bit earlier on with Eddie, is we can actually then convert this to a monetary figure. We use the HMR Treasury Green Book guidance, and we then worked with the co-author of that Green Book guidance, Christian Kukel from the London School of Economics, and we came up with this figure in the middle of £29 billion for the impact for all of England. And on an individual level, it's about £515. So what this is essentially saying, and it's a little bit weird in context, is saying that if I was to derive the same amount of happiness I get out of my cultural heritage within my very local area, what would someone need to compensate me for? How much would I have to be compensated in income to strip away my local heritage? Now, I imagine most people in this room are going to say I would require far more than £515. This is obviously taking for the whole of England, and it obviously takes into account the area you're in. So for places in, what we found was Stoke-on-Trent, for example, had a really high value. So it would cost them more money. You'd have to compensate people in Stoke-on-Trent a lot more money than it would for, I'm not going to name any other locations, so I feel like you get into an issue there. And that's where we get this. So we get this £515 average impact. All the other numbers, we provide confidence intervals with all of these stuff. So you can have a lower value of a well-being. And just to be clear, what a well-being is here, or a well-be, is basically saying how much money, again, would I need to be compensated to go 1 unit higher in my happiness? So how much money would I have to be compensated to go from a 6 to a 7 in terms of my life satisfaction? They're all quite abstract concepts, and there is a little bit more complexity inside that. So, don't be thinking £13,000, 1 unit of I can be 10% happier. It's not quite like that, but it's the basic principle that we can do this with. The 1 kilometre, it might have just sounded absolutely abstract, and it was at first. But what we did was we tested to see how it reacted with the other variables we had. The only real crucial figure you're looking at is this 3.92 here. And that says that's our most significant one. So that's where we get the best statistical results. We then found that listed buildings were the main driver of this, partly because listed buildings are the most prevalent in the asset register, and they're also what's most around us. There's not many World Heritage sites, and not many within 1 kilometre of where you live. The frequencies look a bit funny here. That's because they can be counted more than once. Because if you in a city area, that 1 kilometre central ring can overlap quite a lot. The other one that we find significance with is parks and gardens. Now, we shied away from this finding a little bit because it's at this point in time not possible to differentiate the impact of being in an urban green space and having a nice green park next to you compared to its heritage element of being a registered park and garden. So we talk mostly about this listed building impact, but then we also, in our main variable, we're counting all of these things in, so including the 8 recs that appear in the data set as well. And this, again, really boring, close your eyes, don't look at that. But what this is basically telling us that is it's actually not the big grade 1 listed buildings that are driving this impact. It's those smaller grade 2, far more abundant listed building and heritage that drives the impact that we see with this life satisfaction. And I think that was a really interesting finding, basically, that you don't need a big, Stonehenge or a Palace of Westminster to get this happiness. That's not doing it, basically, or it's not deriving that happiness. It's that local buildings, it's those pubs, it's those, I think there's talk about it being cab stands and stuff like that in the newspaper. I think that's nicely edited, which is a lot big aggregation, basically. But yeah, it's that really lower level of, not lower level, but that more abundant level of heritage. This is going to be a repeat of basically what I said, and it should be 29 billion, not 28 billion, so apologies for that. Robustness checks, no one cares about this, but this just proves how robust that we've been with our findings. We've had this verified by Christine Krickel, like I said, the LSE lecture, and the idea of it is that we wanted to bring up a plausible figure that sounds reasonable to people. When people resonate with the number, they say, actually, that does sound realistic, and that means that we can use that in policy-making decisions. Skip that, we're going to do more of this, basically, and we've got lots of more things coming out. And then here's some conclusions and policy recommendations, which I think I'm well above time. So we won't go too much into it, but it does bring it. It's a unique kind of methodological approach. It's evaluating non-market values. It can be used in social cost benefit analysis, which unfortunately is how Treasury makes most of their decisions, unless otherwise specified by a politician, basically. And yeah, let's stop there, basically.
Thanks, Tom. That was really, really brilliant. And actually, I feel like I understand it, which I always certainly don't understand the details, but I understand all the principles, which is amazing. Has anybody got any kind of immediate, just really quick question or two? Because it feels like it's a really valuable opportunity. Could we just get a microphone? Oh, thank you so much.
Really interesting. Thank you very much. Just in terms of the grade 2 listings, why are they more important? Is it because they're local, things that people visit more, or because there are more of them?
It's not because there's more. Oops. It's not because there are more of them. We've controlled for that factor. The exact causal mechanism that comes through, I don't have. I don't know the absolute causality, but we can take a guess, and it might be that you resonate more with those more grade 2 abundant local heritage. It's probably great looking at the Palace of Westminster's once, but I don't feel too much of a connection with it when I walk past it in central London. I probably just get more annoyed that there's loads of people taking pictures and I need to dart around them or something like that. Whereas when you're in your local area and that local kind of cultural heritage, that is more those grade 2 buildings. That is my opinion. I can't tell you that is the reason, but that's my guess.
Because you see it regularly, you walk down the road.
Yeah.
Makes sense. Thank
Yeah.
you.
That was brilliant. Thank you. We've been doing a lot about evaluation and different types of evaluation over the last 2 days. So I'm wondering, this is brilliant and lots of like quantitative data. And just clarify for me, is it purely like quantitative data, or is there any qualitative data to get kind of what he was saying, that kind of impact on what the places meant to people? Was there particular places that meant something to them? And is there any sort of scope going forwards to be looking at that kind of different type of data, which is a whole other ballgame?
So at the moment, no, is the simple answer. But so this is being part of a larger program that's, like I said, the Culture and Heritage Capital Program. We've received quite a reasonable amount from DCMS for Historic England, which means that we've managed to grow our economics team significantly. And in some of those other research programs there, we are combining qualitative data with it. The problem with this is this actual study, the only cost to this was time. It was all using readily available data. Qualitative data is quite expensive, and we're trying to do some things that will require surveying, but they use economic methods rather than that qualitative still. But some of them do have budgets for qualitative data, and I think it's something that we're learning more and more, is that we need to know what are those flows, how do those benefits that we can see, how do they actually kind of flow from this? We need to know this kind of service element of that brings that benefit. And that's what we need qualitative data for. Hopefully we can get more money, basically.
Thank you so much. I'm so sorry. Can I just quickly add on? Is there any thoughts about extending it quantitatively, but I don't know how you do it, for other types of heritage? So proximity to like cultural heritage, skill, craft groups, blacksmith villages.
So with this, and I forgot to say, I think, is that we're not saying that listing a building creates this well-being impact. It's got nothing to. What we're using is the listed building as the National Heritage List for England as a proxy measure to describe the level of cultural heritage in an area. Now, that's not perfect by any means. There's lots of errors with that, but it's a proxy that it's the kind of first attempt at doing it. And we've thought about using other measures for cultural heritage, and it's actually relatively easy to do now. We've got all of this data kind of there and ready to go. So if we can come up with other ways of measuring cultural heritage, preferably at a really localized area, we would be able to do that. Our hypothesis would say that it would come up with the same level of roughly the same figure, because it's got in our opinion, it's got nothing to do with that listing element. It hasn't got. No one knows if it's a listed building or not. Oh, not no one, but lots of people don't. Most people don't know if the building's listed, but they have that cultural heritage in their area and they do experience that.
Thank you. Thanks, Tom. Thank you very much. It strikes me that there's something here about kind of layers of evidence. And actually, we've talked about different kinds of evidence all the way through the last couple of days. And they've all got their place, but something that demonstrates to the government and to other sectors that there is an inherent value in protecting the historic environment, separate from whether it's a designated building or not, I think is hugely valuable. And I think then, like you say, we can kind of build on this, over it, around it and under it, with all of those other elements that will kind of create something really incredible at the end of the Cultural Heritage Capital Programme. So that was really brilliant. I'm going to stop talking to you all now. Thank God for that, you all cry. And I'm going to hand over to, who am I handing over to? Probably Richard and Neil, but I don't know whether they know I'm handing over to them. So it's really just to say goodbye and thanks, but say it in a much cleverer way than I just did.
Shall I go first? It's your venue. You can have the last shout. Okay, thank you. Great. Okay. Right. In a sense, this is the end of 2 days, but what I would really like to encourage you to think of it is as a start of a conversation. So when Linda and I got Desi and Claire in a room and tried to set up the Wellbeing and Heritage Working Group 2 years ago, and we didn't really know what we were doing. We just wanted this conversation. And the group has expanded, it's evolved. It's really extraordinary. Every meeting we now have, there are new people. So we spend most of our time introducing each other, which actually we think is a really important part of this process, because actually it's through the collaborations and the conversations that actually change will happen. So in many ways, what I would just like to say as a summary for the past 2 days, it's been absolutely amazing, really exhausting. Desi and Claire are brilliant. I'm glad they work for us, not you, which is really good. But this isn't the end of this conversation. It's actually the start. The Wellbeing and Heritage Working Group is there to continue these conversations. And, you know, we want you to join in. And the next thing we will say is, we then want you to help us, because 4 of us cannot carry on the conversation by ourselves. So please come and join in. There are so many resources which we're now pulling together and finding that it's going to be really exciting to see how we move that forward over the next 12 months. So thank you. And over to our fantastic host, Richard.
Just want to say a big thank you. As a data fan, my degree was in sociology, research and statistics, and to have my evaluator Simon and Thomas, this is just like the dream ending. So thank you. I was getting very excited with Thomas, and you shouldn't have shared your email with me, because I'm going to be inviting you down to speak to the Active Quarter. But just really for me to say thank you. I've had one of the easiest jobs this week, just to sit, listen and learn. And thank you to Desi, Claire, Linda and Neil. This has been brilliant. It's an absolute privilege to host this, to have the, you know, one of those key things you were talking about is let's have lived experience here. And we've heard a lot of that over this last 2 days, and it really adds and drives us forward. And we had some of our public health team here, so thank you for everyone that shared. That really helps us on a local level. And our Director of Public Health, who was actually, it was her husband's birthday yesterday, and he's in Yorkshire, and so she just wanted to be part of it. She just came back from holiday, came to the drinks, wanted to connect and just reinforce, and I think actually made an offer of some cash. So we will follow that up. But they've been brilliant in just helping raise the profile of how heritage can make a real meaningful difference. And just a huge thank you to Amanda and to Eleanor for doing a fantastic job with the, thank you to the volunteers. That does help. One of our trustees, Sabina's here to see it firsthand and will be reporting back. And just a huge thank you to the wider staff team and especially the volunteers. And it's been lovely. Thank you all to those who have attended and been so warm with your thanks and praise to them, because sometimes it's hard being a volunteer. And they've come away. We had a lovely email from one of them yesterday who's been blown away. And another one who had one of their idols was here and was really clear. So you've really boosted them. And thank you to Craig and the tech team for making this great. So just to say a little thank you to another gift. In your little bags it's Wellbeing. It's a B Corp company. So thank you to Warner's Gin. It's not alcoholic. It's alcohol-free gin. It's made on their site just in Northamptonshire. And if you're wondering on the train home how to combine it, the tip is to take some drink out the tonic and then pour the gin in, and you don't need a cup. But thank you very much. See you soon.